Okay. Welcome for members of the public watching at home. This is the Committee to Study the Feasibility of Universal Basic Income. I am Senator Shanna Bellows, chair of the committee. And looking at the participant list, it looks like we have a quorum. So we're going to go ahead and start with introductions from members of the committee, and then we will go right into our agenda. Starting with my co-chair, Representative Handy.
Thank you, Senator. Good morning, everyone. I'm Jim Handy, representing part of the city of Lewiston. He, him, his.
Thank you. I see Senator Moore is with us.
Good morning. This is Mary Ann Moore, and I represent Senate District 6, which is all of Washington County, as well as Goldsboro, Winter Harbor, and Sullivan, and Hancock County as well.
I see Representative Meyer.
Good morning. This is Michelle Meyer, proudly serving Southern Maine's House District 2, which is Elliott and parts of South Berwick and Kittery. She, her, hers.
Representative Bradstreet.
Representative Bradstreet. Hi, this is Dick Bradstreet, representing House District 80, and that's comprised of Vassalboro, Windsor, Somerville, and part of Augusta. And I'm going to go off video because I have a very poor connection.
You're not the only one, unfortunately. Now we have members of the public who are also serving on the committee, beginning with Sass Linnekin.
Hi there. I'm Sass Linnekin. I use they, them pronouns. I'm out of Central Maine and a lot of lived experience with poverty, and I work with resources for organizing and social change.
Terrific. Samara Lee Daniels.
Hi, my name is Samara Lee Daniels. I live in Lewiston, and I was appointed to the committee to help represent folks currently dealing with poverty.
Michael Howard. I thought Michael was with us. Perhaps.
Me too.
Yeah, sorry. Michael Howard. I'm a professor of philosophy at the University of Maine. I use he, him, his pronouns, and I do research related to basic income.
Karen Anderson.
You're muted, Karen.
Do you need some help unmuting yourself, Karen? You can't unmute yourself.
Oh, I'm so sorry. I'll go through it again. Karen Anderson. Karen Anderson, transporting coffee, apparently much needed, from my kitchen to where I'm going to be sitting for the next 2 hours. I'm a senior director at Goodwill of Northern New England. I help our CEO with our public policy work and also oversee all of our development fundraising programs. And I am thrilled to be part of this committee and look forward to the discussion today. And now I'll mute again.
Thank you. And Tracy Bellinger.
I'm Tracy Bellinger. I am the appointed labor representative. I use she, her, and hers. I live in Portland, and I'm a letter carrier here in Portland as well.
Thank you. So I believe those are the members of our committee who are present today. We are also joined by our terrific staff support analysts, Karen Nadeau and Deirdre Schneider. Karen and Deirdre, if you want to just introduce yourselves so members of the public can see who you are as well.
Sure. I'm Karen Nadeau, and I work for the Office of Policy and Legal Analysis, and Deirdre and I have been assigned to the study.
And I'm Deirdre Schneider, and obviously also work for the Office of Policy and Legal Analysis.
Great. Well, thank you, everyone. So the agenda was circulated. We're going to begin with a presentation from Magnolia Mothers Trust. Carol Wishcamper of Freeport had submitted testimony to our last public hearing, sharing her perspective on the success that's happened in Mississippi. And so we invited Carol and Aisha Niandodo, the executive director of the Magnolia Mothers Trust, and some of the participants to join us. So welcome. If you'd like to introduce yourselves and then present on your project, introduce the mothers, the participants in the project, and thank you for joining us today. Welcome, Carol and Aisha.
Good morning, Senator Bellows, Representative Handy, and the esteemed members of the Study Commission on Basic Income. My name is Carol Wishcamper, she, her, hers, and I'm here with Aisha Niandodo, the Executive Director of Springboard to Opportunities in Jackson, Mississippi, and Ebony Beals, who is one of the Magnolia Mothers Trust, and we're hoping that Sierra McDonough is here or joining us shortly. So I will turn it over to them shortly, but it's a little bit of background. As some of you may know, my husband, Joe Wishcamper, is a Maine-based developer of affordable housing. Federal and state funding requirements they require a provision for resident services, which is generally carried out in a checklist fashion. Several years ago, about a decade ago, Joe had a vision to do more for residents living in these properties and asked me and consultants Betsy Beeman, who many of you may know as former head of the Maine Technology Institute and currently Coastal Enterprise, Inc., and Aisha Niandodo, who was then with the foundation of the Mid-South, to really think about how to design an encompassing program that would offer residents opportunities for success in learning, success in work and career, and success in community engagement and leadership. Springboard for Opportunities was launched in 2013 as a radically resident-driven nonprofit, with Aisha as the founding executive director, initiating a wide array of bold and innovative two-generation programs. About 3 years ago, Aisha came to the realization that while she was listening deeply to residents about program needs, she was not truly hearing what they really needed: cash. Programs are important and beneficial, but without cash, families have very little options for moving out of poverty. Out of that realization, the Magnolia Mothers Trust was born, and Aisha, Ebony, and Sierra are here to tell that story. Good morning, Aisha. Good morning, Ebony and Sierra.
Good morning, Carol. Thank you. And thank you to the committee for having us. And so I'll just give a little context about what the Magnolia Mothers Trust is in specifics, and then I'll allow Ebony and Sierra to definitely share their experiences with this work. So as Carol said, in 2017, we really started to explore what it would look like to allow our families to have cash without restrictions. And the need to provide this cash really was based on what it was that we were hearing from our moms time and time again. And it was really that they lacked the cash to do the basic things that they needed in their life in order to continue to advance in life, school, and work. And then the reason that those opportunities for cash were not there were several. It was because of the ineffective structure of our social safety net. And when I say ineffective, I'm really talking about the punitive aspect of it. So every time you take a step forward, it's like you're taking 2 steps back. And then also specifically here in Mississippi, it is the wage disparities and the wage gap. So here in Mississippi, our current minimum wage is $7.25. And so you can work full time, which many of our mothers do, and still not have enough resources to address the basic needs that you have within your home. And so those pieces coupled really created this pressure box, this pressure box, quite frankly, where constantly individuals were always on a very precarious ledge of any misstep or any emergency pushing them over that edge. And so in recognizing that and hearing that reality, if you run an organization that is radically resident driven, when your residents tell you what a specific need is, you have to figure out how to address it. In 2017, the ideal of giving individuals cash without restrictions was novel to many. Pulling this project off was only possible, quite frankly, because of the dedication of Joe and Carol Wishcamper and always just being champions and cheerleaders for the work, and always being champion and cheerleaders for the family. So when I came to them and said, okay, I really think we need to test this idea, Carol said, okay, let's test this idea. And that's where the Magnolia Mothers Trust came from. And so prior to us testing it, I pulled together a roundtable, a task force of mothers to really help us think about what this project should be. And Ebony was one of the moms at the time who was on that roundtable, and in that development and design of the project, we decided that we would give mothers $1,000 a month for 12 months with no strings attached. So it's $12,000 total. And what those resources do is a couple of things. It gives you the cash, allowing you to not only have your dignity, but also have your power in making the decisions about what it is that you need for yourself and your family. And in providing the cash, we also said, okay, we have to do two other pieces as well. We have to prove the power of cash for this population. And at the time, and still now, Springboard is the only entity working with families in affordable housing as it relates to guaranteed income. Most other organizations in most other cities or municipalities testing guaranteed income are not working with that population because of the punitive aspect of our social safety net, and because of the fear that individuals may lose subsidies or vouchers and those things. And I will say that none of our families have had that happen, and we knew that that would not be the case because we did the research on the front end to really test, to really have an understanding of what that tipping point would be for our families. And so we also wanted to have conversations about policy, really talking about the punitive aspect of it, really talking about, okay, when we are setting up these programs with all of these obligations in order to opt in for participating and in order to receive the benefits, are we creating situations that are actually more stressful for families? So are we, in hindsight, doing harm when we are actually trying to do good with some of our policies and programming decisions that we're making? And how do we go about setting up policies that actually do good without doing harm? And then finally, the piece that we really set out to do with this work is really having conversations about narrative. And for us, it's really important, and because we know that narrative and policy making have to live together in order to get to change. Right now, a lot of the policymakers and a lot of the decisions that are made by individuals who are not really tuned into what is happening on the ground. So how do we really begin to have conversations that take a bottom-up approach and really center the narrative and the needs of individuals within whom these policies are affecting? And in order to do that, we have to have affirming narratives about individuals who are living in these communities and who this is their lived experience. So that's what the work does. That's what the work is. We've been doing this work now for a couple of years. We launched in 2018 with 20 mothers. Sierra was in our first group of mothers, and so she can talk about that experience. But then we were able to continue to work. So we launched in 2018, and then in 2020, we came in with our second cohort of mothers. And I am most proud of, under the backdrop of this pandemic, we have 110 mothers receiving $1,000 a month every month, and the ability that they are able to provide for themselves and their families right now is one of the things that, like, I could retire tomorrow. I'm not retiring, Carol, but I could retire tomorrow and really be good because I'm like, you know what? I have done what I was put here to do. So I am now going to turn it over to Sierra to introduce herself and tell us a little bit about her experience with the Magnolia Mothers Trust, and then Ebony will do the same thing. Thank you.
Hello, everyone. My name is Sierra McDonough. I'm one of the mothers, like Miss Aisha said, that participated in the first go round. The program pretty much helped me in a lot of ways, because for one, I struggled just getting started to going back to school. I needed like funds as far as paying for daycare, transportation, making sure my transportation stayed, running and everything. So I pretty much went through the program, and it helped me get further than I expected, because for one, I ended up going back to school. I got my GED, and I started college right after, something that I didn't even plan. My goal was to just get my GED, but things just kept happening. With the program, it helped my mom. She got sick, and she needed help as far as like getting like different things, as equipment, little things here and there, as far as cancer. So, I mean, I pretty much, the program helped me in a lot of ways, that I most definitely need the funds. And then to be able to have it like right then, not have to wait and be, go through a whole process of trying to see, do you get, approved, or, waiting on the process of, just it taking time for you to actually, everything just started happening right away. So I most definitely was thankful for all of that.
Thank you, Sierra. Ebony, would you like to introduce yourself and give us a little bit of your background?
Yes, good morning, everyone. I'm Ebony Beals, and I am a participant of MMT and also an active participant of Springboard. And I am grateful for the opportunity this morning to come to you guys and tell you how the guaranteed income has assisted me in my everyday life. I am a small business owner of a salon, and every day the money comes in handy just because COVID has come and decided that, we can only do one client a day, and life didn't stop because of that. And just to know that the money is there, and I don't have to worry about it or call or do anything particular in order to receive it has been the greatest. And I can say that I am so grateful and actually blessed to be able to be a part of Mother's Magnolia. So I am here to say that, if you guys are here to make the opportunity so other families around the world can get it, it is absolutely a must for those who are in need.
Thank you, Ebony. And I'll say that both Ebony and Sierra being very modest, Sierra not only completed her GEDs in college, Sierra also got married and moved into home ownership. So she was able to accomplish that. And Ebony, like she says, she's an entrepreneur. She has her own salon. And over the last few months, she has been investing in her business and really growing the opportunities that she's created, not only for herself, but for other individuals, as she is now able to rent out seats in her salon to folks. So that's just a little bit about the power of cash. Like I said, cash is very powerful. We try, to act like it's not, but it creates opportunities, and it creates opportunities not only in the moment, it create opportunities for your future as well, because it really allows you to take a step back, to free up your bandwidth, and to really put a plan of action in place. And so I think that's powerful and that's important. Ebony and Sierra, this is the last question, and then, we'll definitely open it up because I know the committee probably has questions as well. Ebony and Sierra, what do you think the biggest misconception that individuals have about giving people just money?
I'll go first. The biggest misconception is that, one, we are going to not use it for what we're supposed to, right? Even though there is no guideline on how we can use it, or they're worried that, drugs and alcohol will play a part, or just, we're going to spend it frivolously, right? But for the most part, if we're in this situation at the moment, it is because we didn't have enough to carry us forward, right? Or to move us forward. But the money that we did get, if we didn't use it to play catch up, or to, put what we needed in front of us and make it from what we wanted, but that we actually got it, that would be the first. So the misconception would be we're not using it on drugs or alcohol. We're not going out partying. We're actually caring for our families in a way that maybe at one moment we couldn't, but it actually puts some money in the back, so we have saved. We don't have to worry about just the everyday things in life like transportation, or being able to feed our child, or to pay for a light bill that is past due, or all of those things. We're not wasting the money. We're truly doing what we feel is necessary with the money.
Sierra?
Yes, ma'am. I agree with Ms. Bibbs. with the misconception of people thinking you're not going to do or what, you know, you pretty much said that you would do. But most times other things come about. Like my main thing was daycare, but then all of a sudden, you know, I needed to help my mom with things. I needed to, you know, get the car fixed. It's just, not being able to really, you set your goal to do it, you know, you set out to make these be your plans for you doing things with the money, but other things come about. But I most definitely agree as far as like, I'm the type of parent where I most definitely handle everything that, you know, need first and want last. So, I mean, and then having the opportunity to really just, you know, have time with the kids, that most definitely, you know, played a part in it too. Like it's not, you're not having those rules set as far as what you need to do with the money. You know, you just being able to really stress free. If you know, if you're stressing about something that you need in the house, you like being able to go and get it done. So like that's one of the things most definitely, like people thinking you're not going to do what you say you're going to do with the money.
Thank you both. I will turn it back over to the committee chair in order to field any questions. Thank you all so much for the opportunity to share.
Thank you so much, Aisha, Sierra, Ebony, Carol. That was a really powerful and helpful introduction to the work that you're doing in Mississippi. So for members of the committee, if you could use the raise hand function, you do that by going over to the participant list and you can click raise hand I see a question for Representative Bradstreet, who asked me to ask this because he has a poor internet connection. Unfortunately, he is only hearing some of what is coming through. This also chair the broadband caucus. We need to invest in that as well. So his question is this: how were the participants for the Mother's Magnolia Trust selected? Were there certain criteria or was it random?
Thank you for that question. So individuals are selected via a lottery process. The only criteria is that you have to live in one of the affordable housing communities that we operate in Jackson, Mississippi. And for us, having a lottery process was important because we wanted it to be something that was transparent, where individuals knew that everyone had a fair chance to be picked. We didn't want to come in and feel as if we were cherry picking those individuals who we felt may have the best opportunity for success. And that also we needed to allow individuals the opportunity to opt in because this is considered income. So it does impact benefits. So families needed to really have an opportunity to make a conscious decision for themselves about whether or not it was something that they wanted to participate in, rather than it's something that we just making assumptions for and assuming that everyone wants to participate in.
Thank you. Are there other members of the committee? Oh yeah, I see a bunch of hands. Samarali.
Hello. I wanted to ask more about, you said that you went through a process looking at how it works with housing to make sure that it didn't compete with that. Can you talk a little bit about the process of finding those policies? That's something we're concerned about as well.
Yeah, we worked with an economist. And so we worked with a couple of economists, quite frankly. And the reality is that no one could give us a clear understanding of how benefits would be impacted. And that's really a problem with the social safety net system in and of itself, that these systems are not connected. So it's not as if you could say, okay, if you insert $300, it will impact XYZ, or if you insert $1,000, it will impact XYZ. So we had to make an educated guess. And that's why we came up with $1,000 rather than the $500, which is what most of the guaranteed income pilots are doing. And most of the guaranteed income work does is $500. We did $1,000 because we wanted to make sure that individuals had enough to offset for any of the decrease in benefits that would occur, while also having the benefit of the net gain. So on average, individuals have about $300 or $400 in benefits that they're losing. So they still have that net gain of $600 or $700. But on the flip side of that, as it relates to earned income tax credit, this is considered income. So now you can, when you're doing your taxes, you can claim this. So we have also seen that individuals are recouping a lot of those resources back during tax season.
Thank you. Senator Moore.
you, Senator Bellows. I was just curious, now where exactly did the funds come from for the program itself?
Blood, sweat, tears, Carol and Joe, everybody. We received, so initially, the majority of our resources came from Carol and Joe Wishcamper. That's how we were able to get to our pilot. Now we are very thankful that we have a couple of different funders that have come in, but none of our funding is public dollars. And I think that's another piece too, that when we're talking about guaranteed income, and especially right now when there are so many other individuals coming into the conversation, even with the mayors of guaranteed income, currently none of the pilots or none of the demonstration projects are being funded by public resources. It is all private philanthropy that is still, for the most part, seeding this work. Some individuals are now at the place where they're trying to see if they can use some of their CARES funding in order to pay for their guaranteed income work. But as of right now, it's all a private philanthropy that is really helping us get the data and really the momentum behind this movement in this moment.
That's a really interesting idea, sort of encouraging the congressional delegation to think about the next CARES iteration of including monies for pilots for guaranteed income projects through the states potentially. Thank you for flagging that.
And if you all are interested in having conversations about that, I can definitely put you all in contact with it's a couple of different cities that are really looking at if they could use their CARES Act resources that way. So I can put you all in contact with the cities who are exploring that option.
Sass Linnekin has a question. And once you've asked your question, there's a lower hand function under the participants list as well. So go ahead, raise your hand and then lower it. And then that way, if you'd like to raise it again, you're very welcome to. Go ahead, Sass.
Hi. I have two questions, one for Aisha and then one for either both or one of the folks who are included in the program. So my questions changed as I heard you answering some of the other questions. So I was going to ask about the front end research you were talking about, because that's like a huge consideration for me, is like, how is this going to interact with the programs? So I really appreciate you talking about how difficult it is, because we've been doing some work trying to figure that out also, like where the cliffs are, and especially where different programs don't work with each other for that. So I guess the way this question would change would really be like, do you guys know what the percentage of the people who came into the program, how many of them were already on public assistance? Yeah, I guess that would be the question I have for you, Aisha.
Yeah, so we work with families who live in federally subsidized affordable housing. So 100% of our participants are receiving some form of subsidies, whether that's a housing voucher, whether or not that's SNAP, whether or not that's, well, I would say TANF, but no one is receiving TANF because of other issues with TANF. But 100% of our population are receiving some form of subsidies. So.
And then this question is for Ebony and Sierra. Let me start with Sierra. Congratulations on home ownership. That's huge. Housing security. Yay. So it sounds like y'all were in public housing first when you came into this. So can you just speak a little bit about any public assistance programs that you were on, like how this ended up interacting with that, and whether or not that was, or just like how that impacted you, I guess?
It really didn't change too much, simply because I came from having not too much, where I didn't have any income, and then that being the only income that I have. And a lot of programs, they want to know, how are you, paying your bills, or how are you, taking care of yourself anyway. So that played a big part in, having to say whether my mom is helping or, parents or friends are helping. But it really didn't do, make a big difference. Like my food stamps, it went down just a little bit, but I mean, versus having to, food only provides for food, and cash only provides for everything else. So, I rather had more cash than, but no, it didn't do too much to any of my benefits.
Okay, and to answer your question, because the income that I already had, I wasn't eligible for a lot of things here in Mississippi, even being a single mother of 3. So nothing really stopped except my health insurance, because they were like, no, you make too much money, and that's not going to work. So that is how I was affected. I'm still able to live in low income housing. My rent just went up like an extra $263. But I mean, taking that away from the 1,000, I still have money to spend. So I was okay with that. And it is what it is.
Are you without health insurance right now?
Yes, but I cannot wait till November 1st, because guess what I'm going to sign up for? Affordable care insurance. I know that sounds horrible, but yeah, but it's okay though, because I am grateful that I have a primary care physician that works with me every step of the way. So if something is wrong, I just call Dr. Moore, and he definitely sees me, and at a lower cost than if I had insurance.
Okay.
And Mississippi doesn't have Medicaid expansion. So the reality is a lot of our families, unfortunately, do not have health care because we don't have Medicaid expansion in Mississippi. So that's another lovely policy, ineffective policy that we need to fight against.
Tracy has a question.
Yeah, I have just a couple questions. I was wondering, Aisha, kind of maybe if you can talk, I don't know, like certain groups or specific people, maybe how their perception of this organization or this kind of experiment changed from before to after to during to afterwards. So I'm sure everyone had something to say when you first kind of proposed this, and I'm wondering if you like can kind of speak to people that maybe doubted it or had their reservations about it before, and how it changed as the program progressed, maybe through the years.
Oh, Aisha, you're muted. Sorry.
No, you're fine. Thank you for that. I'll say that mindsets about this work have probably changed the most in the last 8 months because of the pandemic. And because we are now recognizing that most Americans, not just some Americans, are in a very precarious financial situation. And that, we currently have since the initial CARES Act, in the last few months, 8 million individuals have been pushed into poverty. So we now are really having conversations about the power of cash and the power of cash without restrictions. When this work was first starting, it was very difficult, and it was difficult for a number of reasons. It was difficult because we really assign the ideal of cash to deservedness. And so we really have, we have wrapped this up into moralism, and we can't subtract, for whatever reason, our ideology of who is deserving and who's not deserving within this country. So that's a lot that we had to combat and work against as well. And then also, individuals were under the under the misconception that we don't know, or we didn't have enough data about cash. The reality is, internationally, we have enough data to show that cash without restrictions really does work, that individuals receive the resources and they go about achieving what it is that they need for themselves and their families. For us, unfortunately, we have gotten so bought into the ideal of programs, and we have gotten so bought into the ideal of the power that we are able to wield on people by telling them what it is that they can and cannot do, that we just work against our own selves and work against what we know, what the data proves is actually possible. So starting the work was hard, sustaining the work was hard, really hard. And I'll talk about that one day, but not today. But the pandemic, like I said, has given this, unfortunately, fresh air, that we are having the conversations at a much quicker pace than we ever anticipated for those of us who have been doing this work for years. And, that's great because we really hopefully will get to the place where we do put policies in place, or we go about changing some of the policies that are already there that are supposed to give individuals cash so that they actually are working the way that they should. So we go about changing TANF, so where it's not a block grant and there is actually more regulations over the regulators of those resources. We go about changing EITC where it can be an opt-out rather than an opt-in, or we expand the definition of work, really taking into consideration the care that caregivers at home are providing. So there are a lot of different ways that these conversations are being expanded and discussed in this moment, and they're all not just with the lens of a universal basic income or a guaranteed income. It really is a lot of conversations about how do we go about changing or expanding some of the policies that are already in place so that they can work more effectively.
Thank you. Representative Meyer has a question.
Thank you, Senator Bellows. I believe that participation in the lottery was one of the criteria was that you had to be living in affordable housing. And I wonder if there's been any consideration to those who are houseless or homeless and maybe on a wait list for affordable housing, or has the lottery been expanded to consider those without a home?
So thank you for that question. So Springboard to Opportunity specifically works with families that live in federally subsidized affordable housing. So for us in our work regarding the Magnolia Mothers Trust and our guaranteed income work, we are only supporting those families because that's our mission. But for other individuals entering this work, there are a lot of different, each other entity is putting their own criteria into place based on who they go about serving. So there are some pilots right now happening, I think in Chicago, that focus specifically on individuals who are not housed. I also think Boston is doing a pilot like that as well. So different individuals are coming in this at different ways. For all of us, the North Star is cash and trust and dignity and no restrictions. But there are a couple of different projects going on.
Aisha, thank you so much. We've kept you and Sierra and Ebony 10 minutes past what we promised, but this was an excellent presentation. We are very grateful for your time and for your willingness to share your experiences. And Carol, thank you for making that connection and your testimony at our first meeting. So we really appreciate your time.
No, thank you all so much for the opportunity. And if there are any other questions or any ways that I can be helpful, please do feel free to reach out. We just want as many people as possible to be served. So thank you all so much.
Thank you. So we'll now move to the next part of the agenda, which is Michael Howard. So we are so lucky to have on this committee an expert on universal basic income, at least for our state. And he's done some pretty significant research. Michael, if you'd like to take the floor and go ahead and present to us on that.
Sure. I have a PowerPoint, so I'll need to be able to share that. Yeah, one of the reasons that I think I've been asked to talk about the Alaska Permanent Fund and what we can learn from that is that I was involved in a project that produced 2 books on the Alaska Permanent Fund, looking at it specifically as a model of universal basic income. So let me share my screen and can everybody see that?
Yes.
Great. Okay. I'll try to go through this quickly. Briefly about the history. After the discovery of oil on Alaska's North Slope, the state of Alaska was flooded with revenue in the state government. And that actually created some problems. People were worried that they would go through another cycle of boom and bust as Alaska had experienced with the gold rush. And so under the leadership of a kind of far-sighted Republican governor by the name of Jay Hammond, they created the Alaska Permanent Fund. And the idea was to, with all this revenue flowing in, to save money for the future, for both for currently living Alaskans, to share the wealth with everybody, and also to have something left over for future generations when the oil money would run out. So about 20% of all the royalties coming to the state of Alaska were deposited in the Alaska Permanent Fund. The remaining 80% has been funding Alaska state government for most of the last couple of decades. And about half of the interest every year has been set aside for dividends. And in 1982, the first dividend checks were sent out. They've averaged around $1,200 per person in Alaska. It's a universal program, so every resident of Alaska who applies for it and has been there for a year gets it. And so you can see in a family of 4, you get almost $5,000 added to the family income. It's regardless of means test, so everybody gets it, rich or poor. In 2019, the dividend was $1,600. It was smaller in 2020, partly because the oil revenue is declining, as well as the price of oil going down. Alaska is in a severe budget crisis. They did away with their income tax and their sales tax, and they relied entirely on oil revenues. And so now they're starting to take some of the dividend money, but it's still going to citizens every year. The relevance for us, I think it's at least twofold. It is, I think, the only example we have anywhere in the world of a long-term, universal, unconditional cash payment as a right of residency. And we can look at this independently of the particular source of revenue and just see what have some of the effects been. Secondly, the Alaska basic income is in the form of a resource dividend, and that has certain distinctive features. It's a way of sharing commonwealth equitably. The oil in Alaska was the common property of the people of Alaska, and this dividend has ensured that it benefits every citizen. It also can be a tool for resource conservation and something to share the wealth with future generations. And it can also, it doesn't really work this way if you're encouraging people to drill oil, but it can be designed as a disincentive to pollution and other environmental or social bads. When we put prices on carbon, we do that to discourage carbon pollution, but the pricing generates revenue, and that revenue can be used as dividends, or it can be used for other public purposes, as in the Regional Greenhouse Gas Initiative that Maine is a part of. The revenue from resources can be put into a sovereign wealth fund. That's what was done in Alaska. If you have a smaller resource stream, you may not have enough to capitalize a large sovereign wealth fund. But in Norway, it's one of the largest sovereign wealth funds in the world, capitalized from North Sea oil, and that entirely funds the Norwegian old age pension program. I submitted a little bit earlier the proposal in Vermont, and I'll say a bit more about that, to create a sovereign wealth fund there. I think that's something we might want to look at. So what did we learn from the permanent fund dividend? It was not introduced as a poverty relief program. Nevertheless, it has had important impacts on poverty. An important thing to note is that the take-up rate is quite remarkable. Nearly everybody who is eligible in Alaska receives the dividends. It's partly because you just have to file a simple application. There's no stigma attached, and everybody gets it. It's had a significant impact on poverty. It reduces poverty by about 2 or 3% compared to having no dividend at all. Between 15 and 25,000 Alaskans are lifted out of poverty annually. And it's especially important in mitigating poverty among Alaskan Native people. Without the permanent fund dividend, 1/3 more would be in poverty. And the same is true for children in Alaska. The share of households with incomes under $10,000 has been less in Alaska than in any other state. And although Alaska has a safety net program like other states in the United States, there always are those people who fall between the cracks because they don't qualify in one way or another. And in Alaska, this includes single men who are ineligible for unemployment insurance, women who have exhausted their TANF benefits, and some seniors. So these people all benefit and are made less poor by the existence of the dividend. I'll just say briefly on inequality, an insight that the Governor Jay Hammond had, which is that proposals to cap dividends, to put a ceiling on them, in order to allow more of the permanent fund money to be used for government spending, he says, equates with imposing a head tax on every Alaskan and only Alaskans, regardless of income. It never makes more sense to cap dividends than to simply ratchet up taxes to raise the same amount. In effect, capping dividends taxes only and all Alaskans. Increasing most taxes spreads the burden to those best able to pay, and also includes transient workers who currently remove so much wealth from our state. I think that's, with Maine's tourist industry, there's some relevance to that insight as well. And I can come back to that if people want to discuss that further. In terms of labor market participation, there's always a worry that if you give people unconditional cash, they'll stop working. But Jones and Marinescu found that there was, in fact, no significant effect on labor supply, employment, or working hours overall. Different people respond differently if they are receiving a dividend. Some people will maybe cut their work hours, but how do you get this net zero effect? They suggest that one explanation is that any disincentive effects from cash transfers might be offset by increased spending, which leads to increased demand for workers. So some people leaving the market are actually replaced by other people who now have opportunities. And Goldsmith has observed that the labor force participation rate has actually trended upward over the years, despite the fact that there's a rising number of people over 65 in Alaska. And these findings are fairly consistent with other experiments, such as the Dauphin, Manitoba experiment that Evelyn Forget has written about. Other economic effects, the dividend is responsible for about the spending is responsible for generating about 7,000 jobs annually in Alaska. In rural areas especially, a dividend, even one that fluctuates in value from year to year, can provide some stability as well as diversification of cash income sources. In Alaska, as in some areas of Maine, a lot of people survive on hunting and other things in off seasons. And there's some worry, would there be a downward pressure on wages because the dividend would attract more workers and then the larger labor pool would bring down wages? There's no evidence that this has occurred, at least at the level that the dividend currently is paid. A few other quick things. We've learned from Alaska that dividends are popular. Once they're in place, they're universal. They're not perceived as a handout or a transfer, and they are very popular. Everybody in Alaska likes the dividend policy. Sustainable policies like the creation of the permanent fund as well as the dividend itself need ongoing support. So if you're going to put in place a dividend policy, you should try to make it large enough that it really makes a difference to voters. In England, the Labour government instituted a baby bond, but it was so small that nobody saw it as really a significant benefit. And when the Conservative Party came to power, they just did away with it. Resource dividends, once they're in place, they face fairly little opposition. And at least in the case of Alaska, there was support across the aisle. You had a Republican governor, you had a Democratic head of the Senate, you had supporters from both parties that got behind this idea. And it continues to receive support kind of across the ideological spectrum. And from different political perspectives, one can make interesting cases for it. Some people ask, well, this makes sense in Alaska where they have oil, but could you do it anywhere else? I just point out, based on some of the work of Gary Flomenhoft, one of the authors for our book project, even a state like Vermont, which is considered resource poor, has lots of assets that could be part of a public asset trust. Ground and surface water, the land, forests, the atmosphere understood as a carbon sink. You want to limit pollution, but you also want to charge the polluters for emitting carbon into the atmosphere. These are all sources of revenue and could be the basis of a dividend. And Flomenhoff estimated that even in Vermont, you could generate, if you could capture all the rents from these assets, a dividend as high as the Alaska Permanent Fund and maybe as much as $10,000 per person annually. Some suggestions for the committee. I would suggest that we include among the kinds of policies that we look at resource dividends. And that might raise some overlap with environmental concerns that we might want to bring in. If we look at this just as a minimum income policy, we should also, of course, consider other sources of funding for cash transfers. And if we end up recommending a feasibility study, I would say include in that opportunities for modifying existing policies in the direction of cash versus in kind, universal versus targeted benefits, and unconditional as opposed to conditional benefits. And then draw the lessons from basic income and related experiments, including the Alaska permanent dividend, and then make recommendations based on what we know about the state and what we can learn from these policies. And the last slide is just those other policies that we already have in our in the bill that created our committee. So I can stop the screen share. I guess I have to end the slideshow and then.
Thank you so much, Michael. This is really a thoughtful and comprehensive presentation in a short period of time. I just had one question. When you say examine the benefits of cash versus in-kind supports, can you tell me a little bit more about what you mean by that when it comes to public support?
Well, I don't have a position on what might be substituted, but if you look at, say, SNAP benefits, that's not cash. It's a coupon you can use only for food, and so it may be that someone in a given situation, maybe they have a garden and they don't need all of the SNAP benefits, but they can't use it to contribute toward their rent. So maybe just a straight cash benefit would be better than the SNAP. Now, may not be in a position to change that because SNAP is a federal program, but there may be some things within the state budget that we could look at.
So when you're talking about in-kind, you're talking about the benefits that are specific, whether it's food stamps or whether it's heating oil, like the types of benefits that aren't cash, non-cash benefits?
That's right.
Okay.
And it could even, I would not personally favor taking away medical benefits and giving people cash. I think that's ought to be a universal right, but medical benefits are in kind, educational services are in kind. I'm in favor. I think I agree with Evelyn Forget, who's a big advocate of basic income, that it's one among many tools for addressing poverty and social needs more broadly. But there may be some of the existing benefit programs that would be better delivered in cash than they are in their current form.
Thank you. Are there questions or comments or Smarly?
What was the wealth gap prior to Alaska doing this in, I think it said 50, 59 or whatever, and what is it now? How does it address the wealth gap in Alaska?
I actually don't have before and after data on that. What the studies I was looking at, one of them is actually posted for everybody to read. It looked at a certain span of years, and what difference it made that people were receiving the dividend, and what difference it would make if you were to take that away. And so it makes about a 2 to 3% difference in the percentage of people in poverty if getting the dividend versus not receiving it. And it can't help but reduce the wealth gap, because anytime you raise the floor, you're going to dramatically increase the percentage of the income of people at the lower end compared to people at the upper end. And if you were to fund this, not through a resource stream, but through an income tax, then you would be leveling the top down more than you are when you're just funding it from resources. So, I think if Alaska had kept its, here's an interesting fact. My colleague Carl Widerquist, with whom I co-edited these books, he did a calculation of what would have been the effect if Alaska had, instead of taking 20% of the oil revenue, it had put all the revenue in the permanent fund, number one. Number two, if it had taxed other resources besides oil, there are minerals and other resources in Alaska. Number three, it had imposed royalties comparable to what have been imposed in some other countries around the world. The oil companies got a pretty good deal in Alaska. And if it paid out all the interest in dividends, what would the annual dividend have been in Alaska in 2012? And it would have been $18,000 per person. Instead, what Alaska chose to do is to take 80% of the revenue, do away with the income tax and the sales tax, and fund the government with the oil revenue. Now, if everybody were getting that, I'm not saying it's desirable that every person should have that much money every year, but if they'd done that and then they'd funded it with income tax, everybody in Alaska would be much wealthier today than they are, except maybe the people who are paying the upper levels of income tax. So you could have had a considerably flatter income distribution if you had had more going into dividends, and then you had funded state government in Alaska with an income tax the way it is in the state of Maine.
Are there other questions for Michael, or thoughts or comments?
Senator?
Yeah, Representative Handy.
Michael, will you provide your slideshow deck so we can include it in our testimony?
Sure, I've already sent it to Karen.
Awesome, thank you so much.
Great. And we can talk more about this too in the work session portion of this meeting, where we're talking through everyone's perspective on what should be included in our report to the next legislature. So thank you very much. We had some information requests. We had asked Ann Danforth from Aim Equal Justice to be with us as well. I'm trying to see if Ann is with us. Yep, she is. Ann, would you like to check in with us? And Karen has clarified that the PowerPoint that Michael just went through will be posted on the committee's website, which is on the legislature's website, which is legislature.maine.gov. So members of the public can take a look at the PowerPoint and reflect on the content therein. So welcome, Ann.
Thank you, Senator Bellows, and it's great to be here, and thank you for having me. I'm Ann Danforth. I'm a policy advocate at Maine Equal Justice, and we're a nonprofit civil legal aid and economic justice organization working to increase economic security, opportunity, and equity for Maine. And so this memo, which I put together with the help of others from Maine Equal Justice, is intended to provide a comprehensive overview of the safety net available to low-income Mainers. And just kind of to frame it at the outset, I want to say that as an organization that has worked to improve these programs over the year, we do want to stress the critical nature of the existing safety net. And it's really a lifeline that lifts tens of thousands of Mainers out of poverty each year. But at the same time, these programs, as you'll see as we go through, the safety net are really disjointed and uncoordinated, with different eligibility schemes and ways of counting income, different administering agencies, places that you have to go to apply. And because they're so disjointed, they don't interact with each other in a way that is helpful and have the effect of sometimes making people worse off, which Aisha had referenced during her presentation. And then beyond being fragmented, they also just don't provide an adequate amount of support to people. Many of these programs are based on the federal poverty level, which you'll see outlined in Appendix A of this memo. And so these poverty levels are set by the federal government, and you'll see kind of referenced throughout the different safety net programs are often used as a means of determining eligibility. And federal poverty level is widely recognized to be really outdated and no longer a meaningful measure. And you'll note how low these poverty levels really are. I think it's helpful to really see them in context. So a family of 3 is just at poverty level with $21,720 annually, or $1,800 per month. And then people at 50% of the federal poverty level are referred to as those in deep poverty. And so for a family of 3, that would be about $11,000 annually. And then I also just want to highlight at the outset, and I think Aisha did a really great job capturing this, is just that the fundamental nature of these programs is based on ideas about who is deserving and undeserving. And I think that's kind of exemplified too as we see the different eligibilities for these programs. Many exclude people without dependent children, and almost all exclude certain immigrants. And then relatedly, I just think it's important to highlight the ways in which COVID-19 has really highlighted the gaps in the safety net and the lack of access and eligibility for Black, Indigenous, and people of color, in that they exacerbate already disparate impacts these people face. And then also in this memo, we provide some suggestions that can be made to improve programs now to make programs more robust and coordinated, but want to reiterate that those are really short-term fixes and don't have the transformative power or impact of a needs-based guaranteed income. So I can quickly try to tick through the different programs and just highlight what I think are the most important pieces in terms of who they cover, what they're intended to do, and benefits. And so I'll try to go through those quickly. So first we have Temporary Assistance for Needy Families, or TANF. And that provides cash assistance to very low income families, which now in Maine includes 2-parent families with children. And so I'll try to highlight where programs are only available to people with dependent children. And so TANF is one of those programs. And most people who receive TANF have incomes below the poverty line. Refugees, asylees, and certain other immigrants are eligible for federal TANF benefits, and then qualified non-citizens, including asylum seekers, are eligible to receive limited state-funded TANF benefits as long as they meet certain hardship exemptions. And so there is a conditional aspect of receiving TANF. Most adults who receive TANF have to participate in Aspire, which is a work and job training program, which also provides services to participate like childcare. And families that fail to comply with those work requirements are subject to sanction penalties that result in them losing the benefits and their children losing the benefits as well. There's also the Parents as Scholars program, which provides TANF benefits and supports for TANF eligible families who want to attend, parents want to attend a 2 or 4 year post-secondary education program. And then there is also the HOPE program that's available, that's very similar, but is for folks who are not enrolled in TANF. Another important piece is that there is a 60-month lifetime limit for receipt of TANF benefits. And so families may be eligible for extensions to that limit for certain reasons. But I think it's important to note that even people who are eligible for those extensions often don't get them. And it's really also at the discretion of the department to provide those extensions. And then another important piece is just what the benefit is. And so the basic benefit as a percent of the federal poverty level is 34% of the federal poverty level. And then another important piece is just how many people who are eligible for TANF are not receiving TANF. So for every 100 families who live in poverty in Maine, only about 18 receive TANF. So it's really not reaching all the people who are eligible. And TANF is administered by the Department of Health and Human Services Office of Family Independence. Then within the TANF bucket, there are a few related programs. So there's alternative aid and emergency assistance, which are programs that provide temporary and short-term support for families and families with children, which both have different eligibilities. But for these programs, like with TANF, someone must have dependent children. There's the Working Cars for Working Families, which is a pilot program that helps families receiving TANF or Parents as Scholars benefits, or folks who are below 133% of the federal poverty level, to secure and maintain employment through support accessing reliable and affordable transportation. There are also transitional benefits for families leaving TANF due to increased earnings. And so, as with TANF benefits, these are not eligible for people who don't have dependent children. They can provide temporary transportation, childcare, and main care benefits to kind of help bridge the gap between when people leave TANF. And then there's also the Worker Supplement Program, which provides participants who are no longer receiving TANF, but who are receiving SNAP with extra SNAP or food assistance. There's also the General Assistance Program, which is referred to as the safety net of last resort. It serves low-income households whose basic needs are not able to be met by other benefit programs, and it's run by towns and cities in accordance with state law and rules. And so the rules vary between different municipalities since they're are administering it. But in general, if someone's income is less than what they need to pay their basic necessities, they are eligible. And qualified non-citizens, including asylum seekers, are eligible for GA. I think it's important to note that over 85% of general assistance goes towards housing or housing-related needs. And in terms of conditionality for general assistance, some towns do require participants to engage in workfare or work search as a condition of receiving assistance. And then also sometimes a municipality can require that recipients repay the municipality for the GA that they received. And so the way that it's determined how much someone gets is by very closely reviewing their budget, and towns only provide the amount that they deem absolutely necessary to meet someone's unmet needs. And GA is not a cash program. People receive a voucher to take to their landlords or a store. Then there is the SNAP program, Supplemental Nutrition Assistance Program, which is a federally funded and state funded program that helps low-income Maine households with food assistance. The program limits eligibility to people at or below 185% of the federal poverty level. And in terms of conditionality, certain recipients have to work or register for work as a condition of eligibility. And there are some exceptions and time limit waivers and extensions that are available. And currently the state does have a waiver of the 3-month time limit because the state has high rates of unemployment. And so SNAP provides an average of $261 in a benefit monthly for food assistance. And this is administered by the Department of Health and Human Services. Then there's also Medicaid and Maine Care that provides health coverage to non-elderly, non-disabled working age adults with incomes below 138% of the federal poverty level, and to children with family incomes up to 213% of the federal poverty level. And then older Mainers and people with disabilities can qualify with incomes up to 100% of the federal poverty level. And refugees, asylees, and certain other immigrants are eligible for federal Medicaid benefits. And then pregnant women and children who are asylum seekers are also eligible to receive federal Maine Care benefits. And then other adult asylum seekers are not eligible at all. But then all immigrants, regardless of status, are eligible for limited emergency Medicaid services. And Maine Care is administered by the Department of Health and Human Services. There's also the Maine Care Family Planning Benefit, which provides free family planning services to people below 209% of the federal poverty level. Then the state also requires hospitals to provide care for emergency services to anyone under 150% of the federal poverty level, which is referred to as hospital-free care. And then the Affordable Care Act offers subsidies to reduce monthly premiums and out-of-pocket costs for people who want to buy ACA marketplace plans. And that's available to people with up to 400% of the federal poverty level. There's also the Child Care Subsidy Program, which helps low-income families pay for childcare. People are eligible with up to 85% of the state median income. Families are responsible for paying parent fees or co-pays, which are adjusted based on family income. And that's administered by DHHS, but a different kind of sub-department within DHHS. This one is administered by the Office of Child and Family Services. There's also the Women, Infants, and Children's Program, WIC. And so this provides supplemental food, healthcare referrals, and nutrition education for low-income pregnant people and infants. And so this is one of the programs that is only available to people with dependent children or who are pregnant. And the eligibility limit is 185% of the federal poverty level. And this is administered by the Department of Health and Human Services, but is administered by the Center for Disease Control. And you cannot apply online currently. You have to go in and apply at a WIC office. There are also a handful of tax credits available to people with low income. So the Earned Income Tax Credit is a refundable tax credit for working families with children with low to moderate income. And people without children are also eligible, but at a lower income with a reduced benefit. And then Maine has a state level EITC that is a percent of the federal EITC. And that's administered at the state level by Maine Revenue Services. So someone has to apply through the tax system to get that. There's also the Property Tax Fairness Credit and Sales Tax Fairness Credit, which are two state level refundable tax credits for low income folks that help offset the regressive nature of sales tax and to help people with high rent or property tax payments. And those are also administered by Maine Revenue Services. There are also benefits, housing benefits through Maine Housing. So Section 8, the Housing Choice Voucher Program, provides rental assistance to eligible tenants through subsidizing a portion of their monthly rents. And so that's done by paying it directly to landlords. And so in general, a family's income can't exceed 50% of the state's median income. Within the specific geographic area within Maine that the person lives. So those differ based on where someone lives. And then importantly, the wait lists for Section 8 are incredibly long. So for applicants who are not homeless and qualify as a veteran or have a disability or a family preference, the wait list for those folks is 4 years. And even people who have Section 8 vouchers, sometimes it's difficult to use them as landlords will not accept them. And this is administered through Maine Housing. There's the Low Income Home Energy Assistance Program, or LIHEAP, that provides help with fuel bills. And so that is also administered by Maine Housing. And that's for folks who are either under 150% of the federal poverty level or under 60% of the state median income. There are also Social Security disability and supplemental security income benefits. So both of those are available to people who are disabled, but there's a very high threshold for proving disability, and only about 30% of people who apply are deemed disabled and approved. And SSI is a means tested program, while SSD is based on earnings, but someone could get both if their income was low enough. And there is a state supplement to SSI, which is $10 per month per individual and $15 for a couple. And then there's also unemployment insurance. So an individual may be eligible if they are out of work through no fault of their own, if they worked for an employer and made at least $5,336 during the last year, and some of which that must have been earned in 2 different calendar quarters. And so the conditionality for unemployment insurance is that someone must be searching for work or engaging in an education or training program, and that someone cannot turn down a job offer when they are receiving unemployment insurance, and that's administered by the Department of Labor. So that brings me to the end of kind of the overview of what we identified as the safety net. And I said at the beginning it was comprehensive, but it's possible that we are missing some within this overview. And in terms of just coordination, I mean, I think that it is likely clear through this overview that there are dozens of programs and the eligibility is really individualized to each program. It varies between programs. What counts as income and assets is different based on the program, based on whether it's administered and funded at the state level or the federal level. And support from one program is sometimes counted as income for the purposes of another program. So when a family gets more in TANF benefits, they will lose benefits in SNAP, which is sometimes referred to as the benefits cliff, and is something that Aisha referred to during her presentation as well. And so as I get towards the end, I do just want to mention that while at Maine Equal Justice, we strongly believe that we need to take steps to move us towards guaranteed income, we do think that at the same time that there are opportunities to improve the adequacy and coordination of the existing benefit structure now that will help move us in the direction of the long-term goal of providing a guaranteed income. So these are things like increasing the amount that people receive in the state SSI supplement, which is currently $10, increasing the amount people receive through alternative aid or emergency assistance. We could increase Medicaid eligibility for adults and for children. We could make more immigrants eligible for different programs. We could improve and modernize unemployment insurance. And then I think that there are other opportunities to coordinate safety net programs better, to simplify access and provide and make it easier for people to go to one place and get everything that they need, including through data sharing between agencies. So for example, right now, people applying for TANF have to put in one application at the Department of Health and Human Services, and then a separate one through Maine Housing for the heating assistance program, even though someone is financially eligible for, who is financially eligible for TANF is also going to be financially eligible for LIHEAP. So there's an opportunity to just have better integration there and better data sharing so that someone doesn't have to repeat and submit multiple applications. And then I'll also just mention that any transition from the existing safety net to a guaranteed income inherits all the complications of the existing and fragmented safety net. But that's not a reason not to do it, and that there's a really big role here for the state to play. And as we saw from the presentation from Magnolia Mothers Trust and other pilot programs, there are ways to navigate and build on the existing safety net to get people more income without doing any harm. So in conclusion, I just want to kind of reiterate how complex these systems are. Even putting together this memo, it is mind-boggling how many programs there are, how complex they are. And just imagine being someone who is attempting to navigate these programs at a time when they're in crisis. I'd encourage folks to try out applying online through My Main Connection, creating an account. It's a really difficult and challenging process, and having to navigate different application systems in the Department of Labor, the Department of Health and Human Services, the Department of Education, Maine Revenue Services. They're all so fragmented. And then just a note on equity, imagine also having to parse out immigration status, and just that many immigrants are fully left out of the safety net. So I will conclude there and welcome questions, and thank you for bearing with me as I provided that overview.
Thank you, Anne. I have to say, seeing a comprehensive memo outlining all of the programs that are available in Maine, just when we talk about the social safety net, I don't think we always look at the big picture. It was an incredibly thoughtful and thorough memo that I've shared with my colleagues in the Senate and Senate staff. So thank you for doing that pre-work for this meeting as well. And I hope all members of the committee, if you haven't had a chance yet to read that memo, definitely take a look at it, because it's very comprehensive. So thank you for that. I see a bunch of hands. Sass.
Actually, Sonali had her hand up first, so
Oh, okay.
I'm happy to
Great.
let her go first.
Sure.
Thanks, Sass. I just had a question about the housing piece. I noticed there was a bunch of voucher programs that weren't in here, like the BRAP and the RAC, STEP voucher. And I might be wrong, is Section 8 the federal voucher, and then Maine State Housing has a separate housing program as well? Is that correct?
So I know that right now during COVID, there has been a state-specific rental support program. Section 8 is the federally funded housing voucher program that is administered at the state level by Maine Housing. In Summarily, I'm not as familiar with these other state level housing vouchers, but I can definitely look into them, and you were probably right that they should be added to this memo. But Section 8 is the federally funded program that is administered at the state level.
Thank you. I know that BRAP and RAC are specifically for disabled folk, and the STEP voucher is a temporary, and supposed to be 1 year, but can be extended to 2 years, but you must be working when you apply. So they all have different eligibility requirements, is why I asked.
Thanks for highlighting that. And right, it really speaks to the complexity, but I would imagine those should definitely be added in here, so thank you.
Sass, would you like to go now?
Sure. First of all, thanks. It is really comprehensive, and I appreciate that a lot. I was curious, with each of these programs, I assume there's a way to find out about them online. Are there clearly stated ways to figure out, like, what where's the cutoff for your income in order to be eligible, and what's the cutoff? Yeah, I mean, I guess that's it. Like, where's the cliff, basically? Is there a way to find out for each of these programs where it is that you'll be knocked off income-wise?
My short answer would be that no, there is no easy, accessible way to find that out. In terms of looking up eligibility, the way that, I mean, for certain programs, I think like the Department of Health and Human Services has on their website very brief, broad descriptions of eligibility, but in order to actually figure out whether you are eligible, you would have to go on to My Main Connection and input all your information, and then that would get kicked over to an eligibility worker who would then talk to you and make that determination. So I would say that there is not a good place to go or not a good way to find out kind of first whether you're eligible, and second, like where those cliffs might occur. And I will also mention that not every program does have an online application. And so I think part of this problem is that while there is for the Department of Health and Human Services, My Main Connection, that has a handful of programs, TANF, SNAP, and Medicaid, the rest of them live elsewhere in other departments. Some of them don't have online applications. So it is a very complex maze to navigate.
Tracy.
Hi, Anne. So yeah, actually, I want to ask about that because you mentioned when you were talking that WIC, you have to go in person to sign up for. That's bananas. Is that always been like that, or is that a COVID change, or is that? I mean, that's for my first question.
Yeah, I think so. As far as I know, that has been the case. It is not a COVID change. That has been the case. I actually wonder if during COVID they have made changes where you are able to apply over the phone. And I don't know that, but I think for certain programs like WIC and then the Home Energy Assistance Program, LIHEAP, there is currently no online application. Also for the Child Care Subsidy Program, there's currently no online application. So it just is like an additional barrier that people are forced to navigate.
Yeah, and that creates a whole different level of vulnerability in situations like COVID. If they're not ready to do online applications or by phone applications, there's obviously going to be a delay on if they even are able to set that up. That's crazy to me. And then my second kind of question, kind of more of an overarching question, is how do people find out about these programs? Like for the most part, and I mean, not like, and not if I were unable to go to a resource like you who could help, if I didn't know where to start, do most people have to find themselves in these situations before they find out about these programs, or how do they find out?
Yeah, that's a great question. And so I do think that many people find out either through a social worker or a nonprofit. I think that if you were to Google it or go to the Department of Health and Human Services website, one of the cases that we have been trying to make for there to be more integration between different departments and programs is that when someone goes to the Department of Health and Human Services to apply for TANF, it would be great if an eligibility worker or if online they could at the same time be screened for or have their application for even the property tax fairness credit or some of these other programs that it would be great for people to know that they're eligible for, especially since someone who is eligible for one is very likely eligible for another. So in terms of coordination between departments and data sharing, I think that there's a lot that can be done there. There's also work that we have been trying to push for more integration between the Department of Labor and the Department of Health and Human Services. So for example, if someone loses their job and goes to a career center at the Department of Labor, it would be wonderful if the workers at the Career Center could say to people, oh, do you have enough food for your family? There's this program you can apply through this way. And so I think that those are the kind of connections that we could move towards. And there's definitely the space. And I think that that moves us in a direction towards guaranteed income, of getting people what they need now in a more seamless way. And while that's not cash assistance, which is what's the goal, I do think that it is getting people more now.
Mm-hmm. Yeah, because some of them are so specific that, you know, you might be in a situation that you don't even realize that there is assistance for until, I guess, someone tells you about it, which is completely bananas. And, you know, and not speaking to the right person at the right time may leave you out in the cold, to say, or to, so to speak, you know. And this is all, you know, just thinking. That's all.
Absolutely. And I will just note too, that in terms of like who you speak to or where you go to apply, like so much is in the hands of the department and up to their discretion and the eligibility workers. And so just to note too, that that's another huge barrier that would be solved by something like guaranteed income.
So I'm mindful that we're running a little bit behind schedule in terms of just how we're proceeding. And I know at least one member of our committee has a hard stop at 12:30. Are there any final burning questions for Anne? I see Sass has a question for Anne.
Hopefully this is something that you will already know, so it'll be a quick answer, and if not, maybe we can come back to it through email or something. But I'm just curious, how many of these programs are ineligible to people with criminal histories?
That's a really great question, Sass, that I unfortunately don't know off the top of my head, but I will find an answer for you and I can follow up with the committee.
And one thing, is Maine Equal Justice Partners working with Code for America at all? There's a really interesting national initiative around integrated benefits and using technology to try to integrate access to benefits online.
Yes, we have been working with them and with Embranet. And so I look forward to seeing what can come out of that work and how we can move in this direction.
Great. Well, thank you so much, Anne, and thanks again for that terrific memo. I encourage everyone in the committee to take a look at it, share it. To Samar Ali's point, obviously we can also deepen it and expand it to include, you know, the other housing vouchers as well. But thank you. Karen Anderson shared some information with the committee about their Goodwill's stability calculator, and so we invited Karen to just share a little bit about this with the committee. Karen, do you want to take the floor? Karen, you're on mute and your video is off.
I know, I'm clumsy today and I apologize for that. And I want to thank you, Senator Bellows, and my sister and fellow committee members and the great staff that has provided support to me. I feel very honored to serve on this committee, and I'm going to try to make my presentation about our stability calculator as brief as I can, and to tell you why I thought it might be a useful tool at some point in the ongoing conversations. So I apologize that this got sent to you. This is as big as we can make it. It is impossible, I think, to read for many of us, and probably out of context, difficult to understand. So Goodwill enters this conversation from the perspective of, we want to help, in the broadest sense, every person in our 3-state territory achieve their greatest potential. And that may be through work for some people, and it may not be through work for some people. But we want people to have fulfilled and stable lives. So the stability calculator, which is built on an open source matrix, the Arizona self-sufficiency matrix, is a way to measure progress from our perspective at Goodwill of getting closer to stability. So that touches on everything we've been talking about in our committee meetings. And this is my personal opinion, the craziness of benefits available and how hard it is to figure it out, and how, you know, earning 5 cents too much knocks you out of a really important benefit. And it just doesn't work very well. And I love that we're talking about the cash piece, because personally, and I think our organization supports this, that could be a big benefit to making everything work better. So what the stability calculator does is recognizes the whole person. So if someone comes to us from a long history of unemployment, long history of living in poverty, quite probably many generations living in poverty, what we need to do first and foremost is understand what are all the barriers to being successful, which may or may not actually include employment, but if that is a goal, how do we help remove barriers to being successful in employment? Thus, the 15 different domains that we look at. And yes, we focus on employment and financial stability, but we recognize that everything we're hearing about in all of our conversations, that transportation is a huge barrier, childcare is a huge barrier, having a reliable, safe, and steady home is a barrier. And the whole list is here, if you can read the tiny print in the lower right-hand corner. We have to touch upon all of those domains for somebody who comes to us who really wants to be stable in a job. And with the combination of resources that we have, some federal money, some private philanthropy, teeny amount, but some, and we are a social enterprise, a nonprofit social enterprise, so some resources we can invest. We have invested in a model that we call Job Connection that brings together all of the workforce related, the training opportunities, the skills assessment with the whole person, whole family situation. So we pair career advisors who have some seasoning with what we call a life navigator, who is someone with very likely a background in social work, counseling of some sort, but very likely most of our life navigators have a background in social work. And we work with self-reporting from the people we work with, where they think they are when they first start to work with us over the typically year or a little longer that we're able to work with them to get them to a place that they consider stable. And it's not a straight line. People feel that they've achieved stability in many of the domains, and then something falls apart, often a car or childcare. But if we have worked with them in how they understand how all of these things are related, the recovery time from setbacks in our experience, and we've worked now with thousands of people because we do this work internally with some of our own employees as well in a very anonymous way, the bounce back time is quicker. So I'm happy to answer specifics, but it's a whole separate conversation that could be had. But I just wanted you to know that there are organizations like ours that have thought a lot about the intersection of, you know, the benefits cliff problems, which I think the whole reason that we got invited to have representation in this committee is 2 and 3 years ago, we were there testifying along with many of the others that we've heard from today and in previous meetings about it's not working the way it should be to help people that are able and want to have employment to be able to get there. And what that means for an individual may be different from one person to the next. Full-time employment may not be possible. So a better combination of public supports and paid work may be what we have to look at. So I'm going to stop because if people have very specific questions, I'm happy to answer them about the model. But I'm also willing to put it aside, but just to know that there is a lot of this thinking. We work very closely with some of our programs with both the departments of Health and Human Services and Labor. And there are selected people in both those departments who I think are beginning to understand how we view this and the complexity. So I want to also offer a glimmer of hope there. And I think that's it for me for now. I'm happy to answer questions.
Thanks so much, Karen. Do any members of the committee have questions about the stability calculator? I see Representative Handy.
It's not about these stability calculator so much as it is going back to Ann's testimony and the memo she wrote about coordination.
Yeah.
Do you see that or agree that coordination is a big part of the problem in people accessing benefits?
Apostrophe, yes. Yes, absolutely. And so with our life navigation piece, we really try to help connect the dots. You know, we have a lot of relationships with a lot of organizations. And if there are organizations we don't yet have relationships with, I would love to hear about that and pass it along to our workforce folks, because it's crazy. It's just crazy to try to figure it out. And if we can help point people in the right direction, we sometimes physically help people get to some of their meetings, particularly in the beginning, if it's all overwhelming, because it's hard for me to figure out, and I am a very privileged person by comparison.
Samarali.
Yes, hello. Just kind of to piggyback off from Representative Handy's question, how many folk coming into your program are aware of the social safety net programs they may be eligible for? How much education do you do around that?
Yeah, it really varies. Most people who will come to us and get, and be part of this particular program need a lot of hand-holding and direction. So I will tell you, when we launched this initiative about 5 years ago, the learning curve for our staff involved in this program was pretty steep, as you can imagine, because you know far better than I do. And some do come with a fair amount of knowledge and a lot of bad experience. So while we don't consider ourselves advocates for individuals, we do a fair amount of helping people get to the right place and the right person to get an answer to a question. And we also help them figure out some of the screening that can be done with available resources prior to any face-to-face conversation. But I'm telling you nothing that you don't already know. It is incredibly confusing, particularly if people are coming to us because they're about to be evicted, and or they have no transportation, and or there are sick members of the family, and those are their more pressing concerns. So it's an important question to keep asking.
Thank you.
Representative Handy.
Thank you, Senator. Karen, can you kind of describe what your intake process is like? You must have a screening tool of something.
We do.
Okay, could you describe what that's like?
Yeah, so it starts with a conversation about what the person's goals are, and then there is that initial screening in all these domains, and whoever's doing the screening identifies, on this scale of 0 to 5, where everyone is at intake in that initial screening. And then on a quarterly basis, that screening is done over and over again throughout as I said, it's typically about a year we work with folks. What we have learned is that often in that initial screening, individuals will overestimate, and in other words, give themselves a higher score than is actually true for them, because there's a trust building process that has to happen, of course. And so we were in the first year or so using this calculator almost universally at that first quarterly meeting, and a lot of the assessments would drop, and we couldn't understand that. And then as more trust was built, we learned that people wanted to overestimate because they didn't want to be perceived as not worth making the investment in, I think is the best way to say it. So, and then the goals are established together. The one requirement that we have for people who come in and work with one of our Job Connection teams is that they really do want to find employment, whatever that means for them, whether it's full-time or part-time. Does that answer your question?
Great. I don't see any other questions, and I do want to move us into the work session before we lose Michael. Thank you so much, Karen.
You're very welcome.
So we're going to move into the work session, and Representative Handy and I thought, as co-chairs, that given that we have members of the committee who are new to the committee process, that we would ask the analyst, Karen, to just walk through the process and help us understand what our goals are today in terms of what a work session is, but also just what the overall committee process was. And Karen circulated a memo. Karen?
Yeah, and I'm also very aware that Professor Howard needs to leave soon. So I'm going to race through this, and I'm hoping I can share a screen. So hopefully you are seeing basically the timeline that I sent you all. Okay, so I'm not going to go through it as much as I plan to, but one thing I did want to remind the committee, when you met last November, you did vote, you did agree as a committee of those present unanimously that you would like to contract with an outside entity for, some sort of feasibility study, because, it was your understanding that, hiring an outside entity to conduct a study would be outside the scope of the authorizing legislation. So you all agreed on that. And the legislators on the committee understood that you would have to either submit an after deadline bill or go through, the joint order process. So, and in March of this year, Senator Bellows did send a letter to it's obviously you're chair of this study committee, but you're also chair of the Committee on Labor and Housing. But just to memorialize that, you sent a letter to the Joint Standing Committee on Labor Housing requesting that the committee report out a joint order. And so what happened was a day later, the Labor and Housing Committee voted. It was a divided report, but a majority of the committee voted in favor of reporting out a joint order, and that if it was passed, it would go directly to the floor and it would amend the authorizing legislation that created the study committee to allow you to seek this outside consultant. So a few days later, on March 17, the joint order actually passed both the House and the Senate. And then later that same day, the legislature adjourned prematurely and indefinitely because of the pandemic. And so I think in the meantime, there was obviously a lot of uncertainty about whether a special session would happen. So I just sort of wanted to kind of describe that so we kind of understand why we are in the position that we're in now. So as a committee, you this is your opportunity. We have this work session to sort of make some decisions about what the next steps might be, and to sort of come to an agreement on what your findings are, and then what your recommendations are. So, and as I mentioned previously in the authorizing legislation, technically the report due date is November 4th. That's obviously not going to happen because our last meeting is November 5th. But I think today will be the heavy lifting with the work session, and really the final meeting is just, I think all the substantive decisions need to be made today, and the final meeting is just sort of reviewing what Deirdre and I draft for you in the next week or less. You know, we will hear what you say today at the work session, and we'll put that together for you, and it'll be your opportunity to look at that and tweak it, but you know, no major changes, hopefully. And so this report will be submitted to the full legislature, and there's a joint rule of the legislature that depending on the subject matter in the report, the policy committee of jurisdiction has the ability to submit legislation, a bill relating to the subject matter of the report. So that could be taxation, that could be labor and housing, that could be health and human services. So that, just be mindful that, you know, committees will be receiving this report, the legislature as a whole, and it will be their opportunity to submit a bill if they want to. So also you received, I guess, to get the discussion going, the chairs did ask me to sort of provide some questions for committee members to ponder, to sort of serve as a framework for discussion. So let me stop sharing my screen, and I can pull that email up for you and share that screen in case some of you may have not received it. So I think this is it. So there, are you seeing the screen with questions? The first question was, what do we as study committee members think about what we learned about universal basic income programs in some of the states that we heard about, Alaska, Mississippi, and Canada? The second question is, what do study committee members think about what we learned about the effectiveness and coordination of existing social safety net programs? We certainly heard a lot about that today from Maine Equal Justice, and even Karen Anderson from Goodwill. And thirdly, what do you think about a recommendation to pursue an economic feasibility study, including costs and benefits as our primary recommendation? And are there other recommendations that you should include in this report? So I'll leave it at that.
Thank you so much, Karen. And just to make sure that we're all on the same page, the structure of the report could be basically a summary of our findings around the existing programs that we studied around universal basic income. So a synopsis of what we learned about Alaska, Mississippi, and Manitoba, and then a synopsis of what we learned about coordination and integration of existing social safety net services, and then recommendations for the next legislature. Is that sort of the format that would take? And then we would have a pretty substantive appendix that would include links to the prior testimony. Is that kind of what a report might look like, or am I missing something?
No, that's perfectly right. Yep.
Okay. So Michael, since you have to leave in about a half an hour, I think what we'd like to do is let every single member of the committee weigh in on those 4 questions that we asked. So when you think about what we learned about Alaska, Mississippi, and Canada, you know, what do you think is important that we include in the report about that? When you think about what we learned about the integration of benefits, what is important to include? And then what do you think the recommendations should be? And Representative Handy and I, looking at the unanimous vote last session of this idea of the need for an outside consultant to do a feasibility study, thought that that should be one of the recommendations, but we wanted your feedback on that piece, and then any additional recommendations from this committee to the next legislature. So Michael, that's a tall order, but if you could address those 4 questions and give your thoughts on what really should be included in the report as recommendations, we would welcome your thoughts before you leave. And we'd love to get to a consensus report. If we could reach consensus as a group on what's included, that would be ideal. But just to remind people, if you don't agree with where the consensus is, you can certainly, there can be an addition that's a minority report. Just know that the legislature, when legislative committees tend to look at this, things that reflect consensus or unanimity tend to be more likely to be adopted, but there's no reason that you have to go along with the majority if you don't agree. So, Michael, go ahead.
Okay, I guess with regard to the feasibility study, I think we've all learned a lot, and probably enough to recommend a basic income. But I think given the truncated time frame in which we've been able to consider all this, that it really deserves a more thorough and complete feasibility study. And so we should recommend that the legislature pass a bill doing that. And we did have a little bit of email exchange, I think, about whether this committee could continue in some form. And my understanding was that formally speaking, it ends as of our next meeting, but I certainly would be willing to serve on a reconstituted committee, and I would hope that others would as well. So I would like to see that in some whatever form that should take. The gist of it should be that our committee or something very close to it could continue to, in order to supervise and shape the charge that would go to whoever would do the feasibility study, and to maybe review proposals that we might submit, put out a call for proposals, and get a good group that could do the feasibility study. As far as what we've learned from the case studies we've reviewed, I think while there may be some downsides to them, they all show the great promise of universal, unconditional cash benefits at whatever level and in lots of different contexts. Certainly enough that Maine should be looking at these kinds of models and looking at our existing programs and thinking of ways that we can, where feasible, move them in that direction. And also the evidence from the existing programs, it seemed pretty clear to me that they all are doing vital things for the people of Maine, but they also make things very difficult for people on low incomes and suffering other kinds of disabilities, and they're insufficiently funded. Part of that, I think, has to do with the fact that they're targeted, and more universal benefits might actually end up better funded. But in any case, we need to look at those safety net programs critically. We can't just be complacent with what we have, because it's not doing the work that it needs to do. And I'm not clear what the 4th question was. There's the feasibility. Yeah.
No, go ahead.
Well, I went through what have we learned, the effectiveness of existing programs, and the recommendation with regard to a feasibility study. And you said there were 4 questions. What was the 4th?
Any other recommendations? And you've given us one, but if there are any other ones.
Yeah, I just suggested that we add to the list resource dividends as another model that at least overlaps with what we've been talking about. It's a source of funding. It may have additional environmental dimensions to it, which might broaden the scope to some extent, or we might want to have a committee that deals with resources and environment also involved if we were to include that. So it complicates things a bit if you throw that in, but it certainly is, in the Alaska case, a way to fund a minimum income guarantee. And it has certain benefits in terms of its universality. It can be tied up with resources and serve a resource conservation function. And so I think it should be at least on the list of things to look at in any feasibility study.
Great, thank you. Is there someone who would like to go next? Maybe raise your hand if you'd like to go next. We're going to ask each person on the committee to speak, so everyone's going to get a chance to go, but I want to honor your willingness. Anyone? Okay, Representative Handy.
I'll bail you out, Senator. Well, I think going forward with a feasibility study is appropriate, and we should have that as our primary recommendation. I think Michael's made some excellent points about what might be included in a charge to such a group. And coordination, this is the pant leg that I won't let go of. There's no coordination, and I think that if this group doesn't ask for legislation to be presented around that, I'll present legislation to create a commission or something that would work toward the coordination and with a focus on efficiency and the ease of making application for programs as part of it. But I think that's a really, really big issue. I think we heard that it's a blockade for many people.
Thank you. Who would like to speak next? Feel free to raise your hand in the chat. I think it tells me the order that people raise their hands. I see Marianne Moore. Oh, you're on mute, Senator Moore. So you can unmute yourself at the bottom of your screen. If you sort of scroll over toward the bottom, there's a mute and unmute button. It should show up.
Yeah, there.
Yeah.
I got out of my Zoom. I was looking at the stability calculator, and it's like, okay, crazy. Well, in answering the questions themselves, I do think it was very interesting to see the way that Alaska, Mississippi, and Canada handled the situation. I think it does prove in all respects the positiveness about the cash models and actually providing the cash. It makes sense when you think about all the different safety net programs that are in place. The use of cash for other things really does help free up and I think helps to remove some of the stress some of our families are facing. Look at the stimulus program, those that received a stimulus check, and what a lot of people were able to buy things they had not been able to buy because they had that cash on hand. My concern, of course, is the funding. Where would we get that source of funding? We all know revenue shortfalls. So I have that concern about the funding. So I like the idea of looking at other funding sources, the dividend, the resource dividends. That would be an interesting approach to it, to look at it and see what are our resources. I think Vermont, I might even be looking at wood, the trees, which we have a lot of trees. We have a lot of water, we have land. So that I think would be some consideration as funding, to be able to find it there. I do think a feasibility study is important. I think we really do. I don't feel like we have enough knowledge to make recommendations. So I think we need someone who's an expert or an organization that's an expert. I know the University of Maine does a lot of different feasibility studies. They may be our resource, to be able to tap into them to actually do the feasibility study. But I do think we should recommend that as a committee. And I echo that everybody's concerned about our safety net programs. They are a nightmare to try to go through. When I was working as a cancer patient navigator, just trying to get people lined up with SNAP and get them lined up with transportation, get them lined up with LIHEAP, it's a mess. So I think there needs to be some, as a recommendation, I think we do need to insist on some taking a look at our safety net programs and finding out what sort of coordination that we might be able to get to that point to help everyone.
Yeah.
Great. Representative Meyer.
Thank you, Senator. I would agree fully with my colleagues, my committee colleagues, that a feasibility study is necessary. Senator Moore and I are fully aware, because we heard about it many times as members of HHS, that it's a nightmare. The integration or lack of integration and coordination of our safety net programs is a deterrent to those most in need, even knowing what's available. And then the myriad ways of accessing, it's a nightmare, and we need to address that fully. I also am very interested in the resource dividends, the Alaska program, and I think that our Climate Council would be interested in that concept as well, and might be looped into. I was on a housing Zoom housing meeting the other day. Maine Housing was on it, something Representative Morales had arranged, and Climate Council was there, or at least one of their members was there. So they are interested in a lot of the programs that we're discussing and that are impactful to those in need. Did I answer all the questions?
I think you did.
Okay, thank you.
Marley.
Sorry, it always takes me a moment. I would like to start with recommendations that we could make for the next in the report. So I wanted to make two recommendations, or well, really one that goes together. So Maine is plagued by significant racial disparities when it comes to economic security. This source can be found on the Justice's site. In 2017, while approximately 15% of white children lived in poverty, the rate was over 40% for children from Maine's tribes and over 53% for children from Maine's Black and African American families. Now, poverty remains notably worse in certain parts of the state in rural areas like Washington County and Somerset counties, for example. Close to 27% and 22% of children were growing up in poverty in 2017, respectively. Across Maine, female-headed single-parent households are almost 3 times more likely to live in poverty than all households with children. All of these stats play into who is eligible for these programs, and kind of goes back into that paternity that we heard Aisha and Ann talking about. With that in mind, Maine has done a permanent commission on that I believe Senator Bellows, you and Representative Handy were able to have some participation in. But in that committee, one of the recommendations that they put through was policy making must be driven by a set of guiding principles that keep structural racism central in lawmakers' mind. Namely, legislators must remember that building awareness takes resources. Awareness alone is not enough. Financial and human resources must be allocated. Policies that are race neutral will ultimately maintain existing disparities. An adequate response requires a structural analysis. Developing solutions should be led by impacted communities, and policies that offer tribal nations in Maine must be enacted in government-to-government relationship. That in mind, I'd like to, recommend that we go through that process of making sure that we're not recommending race-neutral things moving forward, that it's keeping that extreme disparity going forward. And maybe even using this permanent commission as a resource that we can, recommend that future, whatever is drafted, can be gone through that process to make sure that that doesn't continue. And that being said, I'd like to point out that when they're talking about the structures, that structural analysis, these safety net programs are exactly what, a great example of what that's talking about. They're uncoordinated, folk are losing access. We didn't get a chance to talk about all of those intersections because, to be honest, we could be here for months and never actually hear everything. But I'd like to share an experience about why it's so important is because I myself have a child who is disabled. So he receives Social Security. I I also get child support for this child. Because I receive Social Security for that child, if I were to apply for TANF, even though he legally cannot be considered on the TANF grant, I would have to surrender all of my child support that is given for that child to DHHS because they receive, they paid out benefits to the rest of the family. It forces folk to stay into that cycle. You can't get ahead, you can't get your child support, they count that against you, and then you have to prove to the same agency who administers it, which is DHHS, they don't talk to child support. So in those ways, you're in all of these, you're in this structural system that's just holding you down and drowning you at all times. So I really would love to see us look a lot heavier into those systems and how they can be uplifted, as Anne spoke about, automating all of that, making it easier. LIHEAP can be auto eligibility because, when you get LIHEAP, it increases your food stamps. But if you don't get the LIHEAP in time, you have to apply at a specific time frame of the year, or else you can't get the food stamp allotment that allows you to go up. Which of course, preaching to so many choirs here. But all of those things, really need to be looked at and asked, okay, as Aisha said, would it be better for folk to have that cash, lose that couple $100, but gain that larger aspect and get it through the EITC? Being able to bring that conversation into a feasibility and saying, okay, can we do this without actively harming all of these folk in these other systems? Are there folk who would volunteer to go into this as a pilot program and look at that duality? I'd really challenge us with having that kind of conversation, or challenge the next group to have that kind of conversation. And I guess that kind of answers the feasibility study, making sure that that feasibility study comes in with that also race forward mindset.
So I think Tracy was next on the list, but I saw Representative Handy raise his hand rather quickly. Was that just in a small reaction to what Smarley had to say that you wanted to add before we go to Tracy's thoughts on the study, or was it you are on mute, Representative Handy?
Thank you. Everybody deserves a chance. I think Samarali's last statement was what I was going to point out. Make sure that we include that in the charge to the committee, the feasibility study or the group. So thank you for that.
Tracy.
All right. So I've learned a lot during this committee, and I'm really grateful for it. And I truly, it's really interesting to see kind of Alaska and the experimentation that's been done, and see that they make a difference. And I think, the proof is out there. And it's really been eye-opening to hear about all the programs that are in Maine, and the comprehensive list that Anne was able to put forth, and just people's own individual experiences with those programs. And that they are, as Smarley was saying, that it kind of keeps people in this like, you're hovering between these programs and trying to make them work with another. And it's sounds like a job on top of a job. And I think I support definitely looking into the feasibility in Maine as like a large program. But I also, one of the things that I still worry about is that I think socially we are still, as a state and as a country, and are still so uncomfortable with this idea that we're still pretty far away from it. And I don't, and I like to think that maybe that this committee will not, the chances of this committee ending up with universal basic income in the state of Maine seem very slim. But if we, just this idea of having a small pilot program and becoming part of the conversation, this countrywide conversation all of the Magnolia Mothers organization, I think would be a really great thing that we could do. And I don't know really what the government's place in is running a pilot program, or like how feasible that is. But, you know, I think that if we can create data, like even a small pool of data that kind of coincides with what they've done, what Alaska has done, and it shows that it does make a difference, I think that will be a really great thing that we can do as a committee, or at least kind of push forward this idea. And maybe just, you know, maybe Maine isn't the first place to do this. Maybe Maine is, you know, it would be wonderful in my lifetime if it could accomplish this. But, you know, if we could just create more, you know, just boost it up in whatever way we can. And I really, you know, and this has been super enlightening, like I said, but like, unfortunately, not everyone's going to have access to the information we have. And like, you know, there has to be an education component, and like just kind of convincing the public. And I guess that's kind of an incomplete thought, but I would like to see, you know, I'd like to see results that show that it's maybe possible in Maine, maybe we can show the small pilot program in the long run that is working, and just, you know, add more data to the data pool.
I'm curious, so we could certainly make a pilot program one of our recommendations, and I'm just curious, so maybe what we'll do at the end, once everyone has spoken about recommendations, kind of do some polling and check in and see where people are at with that. Because I think that certainly could be one of the recommendations of the report. Yeah. So we have yet to speak. We haven't heard yet from, Michael, since you're going to have to leave before the end of this, do you want to weigh in on the pilot publicly, and whether that should be a recommendation, whether you would support that as a recommendation in the report as well?
Yeah, just I would encourage people to look at the testimony from Evelyn Forget, both on the bill that created our committee and the briefer thing. We have lots of data and lots of pilots, and I think there's enough data on the basis of a feasibility study to recommend statewide policies. And if people resist them, you can start them at a modest level and then plan to build them up. If people are worried about labor market withdrawal from a too high basic income or something like that. But if you meet a lot of resistance and the only thing you can get is a pilot, and then you want to build popular support, then I think that's where the pilot would come in. So I agree with Tracy. It could help build popular support, but we may be able to move ahead of that. The danger with the pilot is you get the pilot 3 years down the road, the opportunity is passed, and it just goes on the shelf. That's what happened in Dauphin, Manitoba. They had a great pilot project, and then the government changed, and it was 30 years before Evelyn Forget dug out all that data and has revealed to us how promising that experiment was. So I have mixed feelings about a pilot.
Sass is next. Sass, do you want to share with us your thoughts on the 4 questions?
Sure. And bear with me, I'm going to be like looking down and looking up. I got a notebook and a lot of notes here. So first I wanted to address, I guess I'll just like go in order. So I really wish we had had more time with the folks from the Magnolia Mothers Project. I think one of the questions that I wish I had had a chance to ask was like, with what they know now, what research, because they had already had research they were trying to get done that they said that they weren't able to even get answers to. So like, first of all, I'd like to know what were those questions. I'd also like to know what other questions arose now that they've done it. And now that they've done it, what solutions have already come to mind or that they instituted that helped to mitigate things that had to do with interacting, the interactions with public assistance that maybe had negative impacts, particularly around things like health insurance is a big deal. The thing with Alaska, and this is like a little different because it's dividends, not quite the same thing, but the thing that struck me as I listened to that, and this isn't going to come as a surprise to any of you because you've heard me say over and over again how I am cringy thinking about it being universal. I just really want to really have us thinking about why. Why do we want to do this, right? What is the point? Is this about lifting all people into a situation of having a basic level of survival? And if it is, we need to think about resources in terms of preciousness and thinking about money that, like the ways in which it would widen the wealth gap if it was universal, both because if it were to replace public assistance, but it wouldn't replace somebody's salary, it would just be an addition. That would be a situation where you're widening the wealth gap. But also we need to think about the fact that people who are living on public assistance, when they receive this money, even if it was just additional to their public assistance, at that point, they're now doing damage control and just trying to pull out of poverty. Whereas people who are in the middle class are going to use that money to grow wealth. People in poverty aren't necessarily going to be growing wealth. They're just going to be clawing back to surviving. So I really think that that needs to be articulated somehow, and I don't think that what's going to come out of this is that we're recommending that we institute a program, because that would be really quick to do since we weren't able to do a lot of the other work. But I think that it needs to be named somewhere that that intention is really important. Why are we doing what we're doing? So that was that. The question around what do we think about what we learned about the effectiveness and coordination of existing social safety net programs, and what I have written down here is not much. I feel like what we learned was these are the ones that exist, but what we don't know is how do they actually interact with each other? How, where are the cliffs? Where are the eligibility? Who is eligible? Who isn't? How does public charge fit into these things? I think that that's a really, really important piece to be considering when we get to that next question. Around whether or not we should be doing a feasibility study on whether or not it's even economically viable. So one of the folks here said something about like, well, where would we get the funding? We already know we have a shortfall. Well, this is where that question about whether or not we should move forward with studying the feasibility seems like putting the cart before the horse to me, because it would be really easy if we just studied the feasibility right now based on programs as they exist right at this moment, without even actually having the information about how they may or may not interact. That could end up causing a situation where we say, oh, look, it's not feasible. We don't have the money because we're doing all of these other programs. Instead of looking at those programs and saying this, because I don't feel like what we discussed or like studied had to do with the effectiveness necessarily. But if we were looking at that, if we did recommend that we were actually continuing to move forward with like, how do these things interact? How do they benefit? How is there a negative impact? It may result in something that creates more streamlining, that would then open up funding. And let's see, I just want to make sure I don't miss anything here. I also think that in terms of considering whether or not we should recommend studying feasibility, we need to, I think it would be good to recommend a study that aggregates data, like that actually aggregates the data from existing pilot programs as well as existing safety net programs that very specifically, like Samad Ali pointed out, is race forward, that is actually looking at, you know, the disparities that exist. I mean, because if we think about the fact that like the disparities that she was talking about in terms of even rates of poverty for people who are Black and Indigenous, then we already know that if something is effective or not effective, it's going to disproportionately impact people who are already disproportionately impacted in all the ways that our system is not very just. So let's see, let me just make sure I've got everything here because I don't want to wish I had said something I hadn't said. I want to say out loud that I am always in favor of doing cash in place of paternal programs. It's not necessarily a recommendation we're going to make, but I want it stated publicly that 100%, I couldn't have agreed more with the woman who said, well, yeah, you know, it might have replaced my food stamps, but I'd rather have cash, of course, you know, because then you can do what you need to do. We all know what we need better than somebody else does. So I suggest creating a study that includes researching exactly what the cliffs are, and also making a suggestion that if we are to eventually get to a point of instituting even a pilot program, that it is written in a way that's malleable. So, you know, one of the things I think that came out of this was the public assistance programs are really confusing and we don't know all of these things that would be useful to know. So it's possible that even if we aggregate a bunch of data, we're still not going to actually know all the ins and outs of how this could impact people. And so when we do eventually institute it, that it is written in a way that if those impacts start to come up, it's a flexible thing where we can address that and rework how it functions. So I think that was all I had to say. The question of like what else really is, I guess, just reiterating, like thinking through what it means to create a wealth gap if it's not means tested, for all the money that would be going to people in the middle class. Like, I think something was said about like, why would we put a cap? I think this was, and this may be a little bit different, but like, if it were given universally, that would be a lot of money that was going to people who weren't in poverty. That if it was means tested, that doesn't necessarily have to mean that we're only dedicating now less funds because it's only going to people who are poor. It could mean that we're allocating more funds to people who are poor. So I just want to say all of that stuff out loud.
Thank you, Sass.
Hopefully it's something.
It's not your last chance.
distilled.
I mean, the work session doesn't have time limits and we can continue the discussion. One thing, just as a cautionary note, because this is a public meeting and it's streaming online, which is terrific, but I want to just encourage people not to share substantive comments in the chat because the public can't see the chat. So I'm just going to read the substantive comments that were made so that the public has access to things that committee members were saying to each other in the chat, just briefly. And then I know that we're still waiting to hear from Karen and Dick Bradstreet. So Michael Howard responded, a pilot may help in convincing people, but we have lots of data, and I would hope that eventually we could get to statewide policies from a feasibility study. He then wrote, the solution is to tax the benefit back from the wealthy. And Samara Lee wrote, I just tried to like Howard's last comment about taxing wealthy folks. Would just like to echo thoughts on taxing and suggest maybe looking at reversing tax cuts to the wealthy. So I just wanted to read those comments out loud so that members of the public had access to them as well, and just remind folks that under the legislative rules, because we're in a public meeting, we can talk about process, like, did you want to speak? Are you up next? But our comments on the substance really should be orally, so that the public can see and hear. So Karen and then Dick Bradstreet, if you want to share your thoughts on, and actually we may have lost Representative Bradstreet along the way. So Karen, do you want to share your thoughts? The 4 questions are anything you want to make sure, thoughts, reflections you had on what we learned about Alaska, Mississippi, and Manitoba, reflections on what we learned about the integration or lack of integration of benefits, ineffectiveness of existing benefits, whether you think the economic feasibility study should be one of the recommendations, and any other recommendations you see for the report.
Okay, first I really want to thank SAS for clarifying a lot of my thinking that I hadn't been able to distill quite as well, because I think she touched on answers to or pieces of answers to several of these things. I think we did learn that cash is a much better way for people struggling with very limited resources to actually be able to achieve the things that help them best. And I think that there is a lot of data, but it's not always accessible. So maybe, again, I think this was SAS, but I think it might have been another person's recommendation too. I have been taking Fast and Furious notes, but not always getting everyone's names down. That we really need to know what we do know with all of our programs that are not always easy to find. And I am very concerned about our ongoing challenges in Maine and across the country to really pay attention to the dramatically worse disparities for people of color, tribal people. And so I just would underscore that we need to really do this well. We need to have people involved in whatever recommendations move forward who have lived experience, and that we are bringing data and experience to the conversation. What did I miss?
I think you're good. And again, it's not, I wanted to make sure everyone had a chance to speak, but it's not your only chance to speak.
Yep. I am good.
So, yeah. So Karen, do you want to, well, let's start with reflections on Mississippi, Alaska, and Manitoba. There's pretty substantial testimony. I think that 3 things that I would want to make sure that were manifest in the description of what we learned about those was that a cash benefit has had a very positive impact on poverty reduction in all 3 of those experiences, and that the committee heard substantial testimony about the benefits in terms of upholding the dignity and respect to the beneficiaries in those programs as well. So I just wanted to add that. And in terms of the integration of benefits, I think we should also include in that paragraph that we heard substantial testimony from people with lived experiences with Maine's programs about the complete and utter lack of coordination, and how that lack of coordination and lack of accessibility undermines the dignity and respect of beneficiaries in Maine, and how it creates barriers to participation and exacerbates existing inequalities and disparities, especially when it comes just racism, structural racism within those programs as well. And so I don't know, does anybody disagree with those additions that I just suggested? Okay.
I'm sorry, can you repeat them again? I'm not sure if I got them all.
Sure. Just that when we talk about, when we summarize that first, when we summarize our learnings or our findings about Mississippi, Alaska, and Manitoba, that we include that there's a clear correlation between a guaranteed basic income program and reduction in poverty. That in all of those experiences, there was a positive impact on lifting people out of poverty and creating more financial stability. That when it came to looking at the effectiveness and integration of benefits in Maine, that we heard substantial public testimony from people with lived experiences, and that the lack of coordination and the barriers and hoops is not the right word, but basically the significant and challenging and complicated processes for accessing benefits in Maine has had a negative impact and has not supported the dignity and respect of recipients, but it's in fact added to their stress during stressful situations, and that the lack of coordination and the lack of, and the way the barriers in those systems have perpetuated racial inequality in our state and racism in our state.
Thank you. I fully support
that. Michelle, you had a comment or a question? Or is that your hand raised from a prior? I'm going to guess that it's from a prior thing. So with regards to the economic feasibility study, I'm trying to assess whether there was consensus or not. Do we want, as a committee, to recommend that the next legislature, it seemed like most people agreed that we did want to recommend an economic feasibility that would examine sources of revenue, including potentially resource dividends and other sources of revenue, as well as Michael had put in his presentation, sort of looking at universal versus means-tested benefits, looking at, he mentioned cash versus in-kind, although for me, I don't know that we need a study to say that cash is more effective in some ways than in-kind, but what do folks, was there anyone that disagreed with the idea of moving forward with the economic feasibility study? Sass, you had some critiques about doing a study. Do you just?
I think we need to talk about the cliffs first, because I think if we know where the cliffs are, then we're going to know how much money we need. If we don't know where the cliffs are, how can we assess the feasibility of whether or not we can afford it? That's kind of I am like, just to be so clear for everybody who's watching this, I am all about putting cash in the hands of people. I just want to make sure it is not going to end up creating a situation that actually is causing more harm, and that we're putting enough resources behind it.
So what about when we describe the recommendation for an economic feasibility study, including first and foremost an examination of benefit cliffs within existing systems, and the amount that would be required to be adequate to actually lift people up out of poverty, rather than creating, creating harm or undermining their current situation?
When I look at what we were able to accomplish here in what we studied, those sound like two different studies to me. You know what I'm saying? Like, I think that studying how our existing programs interact with each other and what the cliffs are is a whole study. Like, we don't even know the answers to those things. And so I guess I would just say that I have some apprehension that if we were to roll those things in together, that would be the thing that ends up getting dismissed in it.
My only hesitation is one that Michael voiced earlier. I think we're in a time right now where there is renewed interest in the concept of universal basic income. I think that this is an idea to to echo what Tracy said, people are still uncomfortable with the idea of giving a cash benefit. But there's more comfort now than there was even a year ago when we were first having these conversations. So my only worry is if we don't recommend an economic feasibility study for universal basic income, and we just recommend a study of the cliffs for an integration of the benefits, that's where it's going to stop. And I guess I'm in the camp of deep skepticism about some of the benefits of some of our programs reaching everyone that needs it, given how complicated they are to navigate. But that's where my concern comes from in terms of pushing off the idea of the feasibility for UBI. But I'd love to hear everybody else's perspective.
That's a point well taken. And I would just ask then a procedural question, which is like, would it be, can you write the legislation in a way that would actually dictate that that had to be, it had to go in succession, that you had to know the answers to that before like saying whether or not it was feasible? Like that they have to be coordinated with each other. It just, because again, this has nothing to do with me having any aversion to money being given to people. It has to do with making sure that the people receiving the money, like it's not a small thing, you know, like Samadali was talking about that interaction where, you know, one of her children aren't even on the TANF, but she could lose all of her child support, you know, if these things are interacting badly. So
Yeah. Deirdre, do you want to speak to process?
Yeah, I just wanted to clarify, we're probably likely not going to be writing sort of any legislation unless the committee wanted us to have some sample legislation as part of the report, because this may go to multiple committees and then they decide if they want to report out a bill, and those committee would report the bill out. So you could, in the way that you couch the recommendation though, is that it's really important to look at what you were saying, the cliffs and all that sort of stuff, and incorporate that in. It sounded like from at least the Mississippi group there that spoke earlier today, that they hired an economist to come on to sort of try to identify those cliffs and figure out what would be a good amount of money to provide that would still allow them to not be losing any support that they had. And so I think you could incorporate that. And if you're looking at an economic feasibility study, that person tried to figure out what amount would be appropriate to give to people on a universal or some sort of level, that tries to take into account that you don't create anybody getting less than they would have gotten before in the existing safety net programs. I think you could write that in some way as part of the recommendation, that those two things really go hand in hand and you have to understand A before you get to B. And then whatever committee takes this on next session would have to create a bill or a resolve that creates a study group or whatever it is, and there'd be time to have more discussions in that process to help shape exactly how that final legislation would pan out. That might be one way to sort of take those two sort of thoughts and put them together. And like I said, that gives more time for this conversation to occur. You'll have that whole committee process to go through with work sessions and public hearings to further refine that language. I don't know if that makes people feel more comfortable, but that's.
I see a lot of head nodding. Does that make sense to you, Sass? And then I also see Samarali has her hand raised as well.
I think so. I'm going to sit with it a little bit as we continue to conversate. And if I have other thoughts about that, I'll certainly bring them up.
Sure. Samarali?
Hi, I just wanted to clarify, I believe one of the kind of findings that we had all agreed on in some capacity was that we just didn't have enough knowledge about how those systems were really engaging other systems, how they could be streamlined or those things could be reduced. I echo with Sass that we're even struggling coming to the second part because of that first part of like, what are our systems? How are they going through? We recognize that, you know, the extensive research that Anne did through Maine Equal Justice might not even have shown us all of those programs, and even, the intricacies between those. So I would kind of echo with Sass that I think there should be some acknowledgement that these two things kind of came hand in hand, especially for us in this next step forward.
And I heard a second recommendation from Representative Handy that was pretty powerful in terms of, in addition to an economic feasibility that's looking at the feasibility of UBI, and as a piece of that feasibility, looking at what's the benefit that's large enough that will benefit people despite the cliffs. So looking at the cliffs as a piece of that study. But I also heard a second commission from Representative Handy to look at how to better integrate means programs and streamline means programs and streamline application processes and whatnot.
I'd also like to throw on there maybe a recommendation that that's a living process, because our demographics will change, our folk will change, hopefully as we gain better infrastructure and broadband and roads and things like that. Transportation might not be the same issue, and we can really be talking about those conversations more than just when something like this study pops up, because when we asked for that exact report that Anne did, Anne as an outside agency did it. It's just coordinating between all these places. The legislature as a body can't identify where these programs are. I'm concerned about how the legislature moves forward in all of its future conversations and thoughts about poor folk and those demographics, how they break down and what folks' needs are.
Representative Meyer, did you want to add to the conversation here? Your hand is raised, but it may just be from before.
It is. I'm sorry. I'll lower it.
Okay.
Thank you.
So does anyone disagree with Representative Handy's recommendation as a second recommendation as amplified summarily? And I think it would be very important for me in that recommendation to include that this committee is looking at racial disparities and structural inequities in those programs as well.
I would like to enthusiastically eye that.
Okay, I
would like to eye it.
I don't hear any disagreement. From a process perspective, Karen and Deirdre, is it okay that I'm doing that? Does anybody disagree, or would you like individual votes on these recommendations?
No, it's fine the way you're proceeding. Although Representative Bradstreet was on earlier, but I think he was having technical difficulties. So I think Deirdre had sent him a link to the audio so he could at least listen. So I don't know if he's still listening. It would be good to get him in on the conversation if he's still present.
I don't see any phone. Representative Bradstreet.
Procedural question?
Yeah,
Just
absolutely.
so if we are doing this in a way where you're asking if there's just anybody that disagrees and nobody raises their hand, does that mean that it's recorded as a vote in favor?
No, the report itself will just look at, well, actually, Karen or Deirdre, do you want to answer the question rather than me?
Yeah, basically, what's the difference?
So the report isn't, if it's basically, it'll come forward as a consensus recommendation or consensus report. So sometimes you see a report from a special committee and there are subsections with votes like 7-3 or whatever, right? 6-4-3. And then there's a minority report, and then you see the votes next to those recommendations. Other times you see a report and it's just one report and you're not interrupted by seeing numbers of people who are for or people who are against. What you're seeing is a consensus from the committee where people in general felt like they could get behind what was in the report. So my recommendation at the beginning of this meeting was that just as someone who reads those reports or receives them in committee, I think that the reports that are consensus based, if we can get to yes as unanimously as possible, those tend to be more powerful and have a higher long-term positive impact in terms of, the legislature then adopting the recommendations in the report as a next step than the reports that have divided recommendations, but also want to recognize that each committee member is free to do whatever they want to do.
That was helpful. Thank you.
Yeah. I heard another recommendation was from Tracy and want to just explore this one a little bit more. We could recommend as well that the legislature implement a pilot project for universal basic income. And, Michael had expressed a little bit of hesitation that a pilot project could get us stuck in a pilot rather than going to statewide. But Tracy, you had made a compelling case as well that, it feels like this is a topic that keeps getting studied rather than getting acted upon. So just curious about where people are at. I'm comfortable with a pilot project as a recommendation. I think if we were to do it in a place like, for example, I think unfortunately in the legislature, sometimes the north-south divide can make things more challenging where people sometimes discount, and this is not fair necessarily, but it's just a reflection of what I have observed in the legislature, sometimes discount studies that happen in Portland or greater Portland. So it might be interesting to do, for example, a pilot in Washington County, where you do have significant and important Indigenous and people of color there. So if people think a pilot project is a good idea, let's talk about that. And forgive me, I said this earlier, but people might have missed it. Please don't put your vote in the chat because for the public view, the public needs to know what our perspectives are. So if you would like to weigh in, Representative Meyer, I'm going to encourage you to weigh in orally.
I apologize. I'm in agreement on the pilot project.
Other thoughts on the pilot project?
I just echo that if we do the pilot project, having that permanent commission, have a thought in that and have some say so they can bring in impacted folk from all of those demographic thoughts.
I see a thumbs up from SAS. Senator Moore, do you have thoughts about a pilot?
Yes, I do. I'm really hesitant about supporting a pilot project. And basically for what you were saying, Senator Bellows, when we've looked at that at DHHS and we've recommended pilot projects, then you get into where do we do it? Where is the best? What is going to give us the best data as far as the success rate? And then again, then at the end of this pilot, what happens? So I really am hesitant in supporting a pilot project. Not only that, it's also the funding because we don't have an idea yet as to what the funding was. I wish we had a foundation that was very generous and would give us some money to be able to do the pilot. But I just, in past experience with pilot projects, I'm not recommending that in my part of it.
Okay. I see Representative Handy and then Sass Linnekin. I do just want to, you just said something that triggered something I wanted to share. If we had a foundation who could fund a pilot project, and the state can accept money for these types of efforts, but it's a little bit tricky. So we had an institute, the Jane Institute, which submitted a memo and testimony to this committee, and they had offered to study the feasibility for free for us. But that does bring into question to do a truly objective, impartial study. We would have to get permission from the Legislative Council to proceed with inviting an outside group to do a study, and they would have to make some affirmations to the legislature about their interests in doing so and where they're coming from. So I just want to say the private foundation is not as simple just because of the nature of state government. State government isn't, it's not that it's impossible, but it rarely happens that state government is accepting private funds for particular initiatives because it calls into question private interest versus the public interest. Laudable as those might be. So I just wanted to flag that. Representative Handy.
Thank you, Senator Bellows. I concur with every point that Senator Moore made. Those are that's where my anxiety is, whether we can get one funded, and most particularly, what happens afterward? Have we all done the universal based income and, we move on to the next thing? I also think that although we have data on at least three successful projects in two states and one province, it seems to me that we need to see how this impacts Maine. And I think the feasibility study is really a key to moving on to state policy as opposed to a pilot, which I don't see really evolving into state policy. So I concur with Senator Moore.
Okay, Sass?
Initially, I just wanted to clarify that I was giving the thumbs up to the idea that if we did it, it was done with through the lens of racial equity. And I also just want to say, what if we did a pilot program as part of the feasibility study? Like, it could be working in tandem, like we're looking at that data, we're studying the feasibility, and we have these real world results to look at, because like I said before, like there'll probably be things that no matter how much data we look at, there'll be small interactions that you couldn't have seen on paper that when somebody says, hey, this is how this actually impacted me, we can see it. Because I really also just want to underline, like, so often poor people are talked about in framing of dollars and cents, and just like really thinking through human impact. I think I initially probably didn't think I would have come in here being like, yeah, let's do a pilot study, but I am thinking a lot about human impact and how that might actually give some real world kind of ways of looking at it in tandem with whether or not we actually could afford to do it as a permanent program.
Smarly?
Sorry, I got myself stuck. Just wanted to hear some more about those experiences with past pilot programs, like about those outcomes, like what kept those from being moved into an actual program.
Senator Moore, do you want to address some of your observations in the Health and Human Services Committee about past pilot projects that may not have led to the next step that everyone hoped that they might?
Trying to think of exactly the ones that we have talked about in right off the top of my head, but I know that there was several of them that were done, for example, in Cumberland County, and it never really materialized. I'm trying to remember exactly what the details were about it. But again, I kept saying, what about rural? Everything was always in the urban locations. All of the pilots seemed to be in the urban. And then when we were recommending a pilot program, trying to remember if it was for what it was exactly for. And then we said, well, what about a rural location? Well, then we couldn't decide on which rural location. We've got a lot of rural areas within Maine. So that's why and the funding that went with it. And I remember the school-based health centers. That was a pilot to begin with. And we started with 15 schools. And every year we had to struggle to get the funding to fund the 15 that are very, very successful. But then, Jim, in fact, I think you were the one that Representative Henny was the one that suggested we add 15 more. Well, that one didn't pass because we really don't have the funding for that. We did good to get the ongoing funding for the school-based health centers, the current ones that are in place, but we just didn't have the funding for the additional ones. So that's just kind of some examples, because then you go into that ongoing funding that becomes a nightmare, and it's successful, but then you can't fund it, then you have to stop the program. I hope that helped a little bit as an example.
It did, thank you.
You're welcome.
Tracey, you wanted to weigh in again?
Yeah, it's interesting listening to why it wouldn't work. And I do put a lot of weight into the fact that people that have been involved with pilot programs in the past see how frustrating or how like they don't come into fruition the way that they want to. And I think, oh, I just lost my thought. You know, but I to be really honest with you, and like I'm just to give a little background about myself, is that my partner has actually worked with homeless populations here and in New York for over a decade, and he over a decade ago he started saying to me, like, we should just give people cash, like we should just give people cash, and I was very not on board with that. And even to the point where I came into this group, I wasn't sure how I was going to feel about it. And seeing the information that of these successful programs has been really, really good for me, and has really really helped to change my opinion about it and think that it is a good thing. This has been something that's been a bug in my ear for 10 years. And I truly don't think that I think that the evidence that it works is still very limited. It's all very positive, but it's very limited. Like, that's only a few programs that have been successful. And, you know, so, I mean, I could feel either way. Like I said, I put a lot of weight into the fact that some of our community members that have experience with them are hesitant to do it. But I also think to prove to the people of Maine, and just to have more data to show that this works, is a very important thing. So honestly, like, I respect either way that this committee chooses to go with the pilot idea.
Samarali?
Are there other thoughts on actions that we could suggest that may not be a pilot program, but could give us some actionable movement towards not just education, but actually fruition?
So I have to say, I see the feasibility study as a movement toward action, because I think the first two questions any legislator is going to ask is, what is the level of the benefit that you're proposing? And how is that going to impact existing benefit programs? And then what are the total and overall costs, and what are the sources of revenue to pay for that? So even though it shouldn't necessarily be, well, I just think that those are the questions that legislators are going to ask before they are willing to support a statewide universal basic income program. And so I think I understand that the word study doesn't feel like action, but I do think, just like in, you know, when you're building a new transportation project, you do a feasibility study first, or if you're doing an economic development project, you do a feasibility study first. I think this is a necessary action step for that. So yeah, go ahead.
I'd like to ask you, you keep saying universal basic income. Is that the recommendation this committee is going to make, is a universal basic income?
That's a really good point. I'm not being careful with my terminology. I think I'm using it as a placeholder or as a synonym for guaranteed basic income, which of course it's not. So we should talk about that. Are we talking about, because the study itself is actually, to your point, just basic income. It's not universal. So I'm not wedded to having it be universal. I hear what Sass is saying. I think there's some benefits to universal programs in terms of bipartisan and broad popular support. And I think you can address inequities through making a fairer tax code. But I'm misspeaking. So unless people feel passionately that it should be universal, I'm happy taking that out and just calling it basic income.
And I'd also like to give a little pushback, because all of the feasibility study is further education, but it's not action. So if we're comparing the feasibility study to the same aspect as a pilot program in action, they're not the same. You know, we do a lot of things to you know, study for education that doesn't come to fruition. I'd like to also go back to highlighting, like, that permanent commission on racial equity. You know, we've been talking about racism for how many years? We do education, we do training through the legislature, all of these things, and it didn't move to action. So my question is there a recommendation that we could make, maybe not a pilot program, but that would push to that same level of action?
I definitely welcome anyone's thoughts on that. Sass, go ahead.
I'll just I'll just be annoying and repeat myself a little and say, what if it was both? What if that was part, we recommended that we do a feasibility study that included a pilot program? Because it's, you know, I definitely hear what's being said about like, oh, pilot programs sometimes just end up dying, but like Smedley's saying, so do study things. So what if we did both? It would certainly create like a, if it came out that not only could we say it was feasible, but look, we did this pilot program in a way where we showed that it was lifting people out of poverty, that'd be a pretty strong argument.
Representative Handy and Senator Moore, what do you think about that proposal?
Thank you, Senator. I suppose we could certainly write it in as part of the proposal for feasibility study. My only concern is that it might be just looked upon as, okay, we've got a pilot going on. We don't need to. I think that it might be wasted energy rather than have a feasibility study that says, yes, this is feasible and here's how you do it. But we have a pilot project. And you gotta consider, what if the pilot project fails? I mean, that's just what I'm feeling right now.
Well, I mean, that's the point, right? We're trying to study whether or not it's feasible. So if the pilot study fails, it's telling us something, right? We would need to do it differently, or like, I am all about money in hand for people, but I am mostly about reducing harm and getting people out of poverty. And so, you know, this isn't about like, let's put forth the agenda that we already think we know, because we don't know what we need to know. So sorry if that was aggressive, but
I still
go ahead, Senator Moore.
I still can't support the idea of a pilot. I just, because again, we're, you know, how many, it's just, there's just too much involved with that. I think we should just go forward with a feasibility study.
Samara Lee?
Maybe, I think at the very least, I would recommend that the report kind of showcase in some way the concern about action, even if it's not a pilot program. That's why I asked if there were other things that could be suggested instead of a pilot program. I'm honestly not sure what that answer is, because I don't write these. But is there a way that we can capture this conversation of concern about not just doing a feasibility study, pushing us further and really asking us to push that envelope?
I think that's a good idea. I wonder, what does the committee think in terms of a consensus sort of statement that, or finding, you know, it is the finding of this committee that basic income programs reduce poverty and could have hugely beneficial impacts in Maine. And with that in mind, it is our recommendation that an economic feasibility study be conducted that includes an analysis of the cliffs and what benefit amount would be appropriate, an analysis of potential sources of revenue, including resource dividends, and the structure of the benefit itself. So basically sort of saying, kind of affirmatively saying, we've listened to this testimony. We've listened to testimony about existing programs, and we find existing programs inadequate. We've listened to testimony about pilots in other places in this country and elsewhere, and we find our findings are that those programs have had very positive impacts. And so we're recommending the feasibility study because we think a statewide basic income program could be very positive for Maine, but we understand that we need to investigate it further before moving forward with it.
Yes. And maybe wording the last part of that sentence a little better, because it kind of pushed, like, it changed the narrative of the whole rest of what you said, because it went back to like, but we need to do more education.
Fair
So,
enough.
you know what I mean? Like, end on education.
Yeah.
Otherwise, I 100% got where you were going.
Okay. That's what happens when you write out loud. Senator Moore, I saw some nodding and some smiling from you. Would that be something, a finding that you could get on board with?
I would be fine with that, Senator Bellows. You worded it very, very good. Karen, I hope you were able to get, I saw you were writing like crazy. So. And Deidre, but yes, I would support that.
Does anyone have any concerns about that as a finding that adds a little bit more action to the recommendation of the economic feasibility study?
Just writing it in with a race forward, that bringing that back to make sure that we're being really, really cognizant of how we're asking like them to build this.
I completely agree. I think everyone does on this call. I see a lot of head nodding. Excellent. Are there any other recommendations that surfaced, Karen and Deirdre, from when you were taking notes, that surfaced in the initial thoughts that people had that we didn't just discuss? Actually, we should wrap up the conversation, forgive me, on the pilot project. So what I heard was that some people were very passionate about doing a pilot project, and some people are not. I would prefer, if we're going to be divided, I would like to leave that recommendation separate from the feasibility study, because I would like to have that feasibility study, if it's possible, given that we have unanimous consensus on that. I think it's more likely to happen and to be supported by the full legislature if it's a unanimous recommendation. And if we put the pilot in there, it's going to it just undermines that particular recommendation. That said, we can have a recommendation for a pilot project that's a divided recommendation. There's no reason that we can't. And so just want to get to a conclusion on that portion of the conversation. Thoughts?
I would agree. As a member here that supports the pilot project, I would agree keeping it separately, keeping it separate. And yes, I don't want to see our recommendation for a feasibility study be divided.
I agree.
Can I ask a question, a clarifying question for those, so where there may be some division in a recommendation, not everybody's on board, and the idea of a pilot project in the recommendation, is the intent to keep it very broad and just say, we recommend that, are you directing anything specific in that, like a pilot project who's overseen by this entity that looks for, public funding or private? I mean, there's a lot of pieces to that. You can recommend a pilot project, but who's overseeing the project, who's working on the project? It wouldn't necessarily be the legislature. It wouldn't be the committee, probably, in that sense, because you have to be formed, and I don't know, it just seems like, so I'm just trying to get some clarity for our purposes in writing the report. Is it just sort of a broad recommendation or pilot project, or were there details that wanted to be included within that and give some direction on how it's going to look, or just the next committee that takes this up will figure that all out?
I'm going to defer to the proponents of a pilot. Tracy, do you have thoughts on this?
Frankly, I think it's more what you were saying about keeping them separate to kind of go ahead with the feasibility study and the basic income. I guess I think that is more important than this pilot program. But I think keeping them separate is the right way to go.
And so to expand on Deirdre's question, so in the report, it would be recommendation number 1, it would be the economic feasibility study with the finding right before it that we just discussed. Recommendation number 2 would be Representative Handy's recommendation amplified with Samarali's explicit language. Actually, both recommendations would have that explicit language about waste forward analysis. And so then recommendation number 3 would be a pilot project for a basic income program. And I think what I hear Deirdre asking is if you could just amplify that recommendation. Are you suggesting a pilot project in a specific area in the state and a particular size or a particular funding source? Is that right, Deirdre?
Yeah, and an entity who's sort of overseeing the pilot project. Somebody's going to have to organize this. Somebody's going to have to figure out the funding, where to put it, the participants. There's got to be some organization organizing the pilot project. And I mean, that could certainly be something that's decided when the report's made and whatever committee gets the report, those details. I just didn't know if this committee, in making that recommendation, wanted anything in particular included in that description of just sort of, we want it in rural areas, or we want 2 small ones, one in a rural and one in an urban area, or, you know, something along those lines, or just, we think a pilot project would be good. Just for our purposes in writing it, because it's not a unanimous decision, that we want to make sure we capture that appropriately in the report.
Actually, I was going to say, can we ask Representative Handy and Senator Senator Moore, perhaps just the feasibility the pilot programs that they've seen, maybe ask for their recommendation in locales and what they would recommend?
Well, you can be as specific as you want. Correct me if I'm wrong, Karen or Deidre. But one of the things I want to say before I forget is that we need to, I think, suggest that if the a pilot project were to happen, it needs to be, like we said, rural and urban. So I'm thinking 2 projects, and also with consideration to people of color and indigenous people. From what I've heard, and I've been enlightened, certainly that has to be a part of it, because that's reality.
Well, and you would have to be specific. I think that's the key. If you're going to recommend the pilot project, you would have to be somewhat specific as to where you are recommending it. What did you want this to look like? That's why there's a lot involved with trying to set up a pilot program that may be beyond the scope of what this committee was actually designed to, or what we were responsible for. Because there's a lot to doing it. Again, not only that, plus the funding and what committee and who's going to be the overseer of it, and the report back. I mean, that's another thing too that has to be included.
So I just want to share my own opinion on the pilot project because it's evolved in this conversation. I'm open to the idea of a pilot project, but I am concerned that a divided recommendation for a pilot project will undermine the positive energy for a basic income program. I really do. I mean, I'm not saying that the legislature will necessarily do this. We are facing a huge budget shortfall. But I do think we are in a moment where people are recognizing that the existing programs are not working. I think more people are trying to access those programs and recognizing that the barriers are significant, that the bureaucracy is absurd, And so I'm reminded a little bit of a choice that advocates made when I was involved in the campaign for marriage equality. And we had a very prominent Republican legislator come to us and say, if you want civil unions, we will give it to you. Go for it. We'll pass it, no problem. And we had to make a decision at that moment in that year about whether we were going to settle for civil unions in Maine or whether we were going to continue to advocate for what we wanted. And we chose not to settle. We advocated for equality. And that took longer because of the public education. It took 7 years that we worked on that. But I think it was important in terms of accessing our ultimate goal. And I think the reason I agreed to chair this committee is because I do believe that we need to get to a place where everyone can live with dignity and respect and get their basic needs met. And I see basic income as a way of addressing some of the deep poverty, particularly child poverty that exists in the state. So I'm a proponent of some sort of, I'd like to see a national basic income program. So I'm expressing some reservations about the pilot project because my concern is that a divided recommendation on that might be interpreted by legislators as a lack of support for the concept, which I don't think is what's being expressed here. And I am a senator who has a school-based health center in one of my school districts, but 4 of my school districts do not have one. So I am familiar with a brilliant program that really works that never got past the pilot phase. So
I would agree, Senator Bellows, as a supporter of the idea that my thoughts have evolved as we've been discussing this, that should we get too prescriptive and bogged down in 1 or 2 pilot projects, that the rest of the work that we're doing here and the recommendations that we intend to make, it's going to complicate things in a way that an already a concept to many that it's new and novel, and I don't want to deviate from the good work that we're doing by getting bogged down with the pilot project concept.
Samarali and then Tracy.
Ironically, my thoughts are evolving as well. Kind of being more so around thinking about these racial disparities a little more, and when I believe Deirdre asked who would administer this. If we're not looking, if we don't have the answers to like where are the racial disparities in these other programs, we don't want to task that same agency with putting those same biases and practices and procedural changes into this program as well. So I'm concerned about that, not being able to identify like which agency would be best, looking at that from a race forward thought frame, and even ableism and all of those things. We see those as areas that where those are areas that are causing the disparities right now in our current programs. So like how folks are getting into these programs via domestic violence, or how they're getting into these programs and getting exemptions based on disability, how many folk are considered disabled, maybe their doctors consider them disabled, the state doesn't consider them disabled. So looking at all of those things, I would be concerned for us to say, let's go ahead and suggest so and so do this pilot without being able to say this is a safe place for all communities to reach this program. So maybe putting off like I would say let's not say a pilot program just yet, because we don't have the resources to identify who would be a best person for the pilot.
Tracy, and then I think Representative Handy, and then Sass.
All right. I think Smarly actually really kind of hit the nail on the head with how I'm feeling about it now, is that although I still think it'd be a good idea, like I can't imagine this committee, since we don't have the answers to those questions, that we like handing this to someone else and ultimately kind of being happy with what comes out of it. Just given how, I think it's like I think, and kind of like just what I was saying, like leaving it separate from the universal basic income or basic income, like that's ultimately our goal here and why we're here. And I think if connecting that is truly has the potential to hurt our what we're trying to do or what this committee isn't originally trying to do, I don't think it should be included. So I'm on board leaving it off.
Okay. Sass?
Hey, I just wanted to say that all of that passion that you saw out of me honestly had to do with like, if we're not going to do it, I don't want it to be because we're saying, well, what if it doesn't work? Because really the only reason I was suggesting it as like, all right, then let's just do it in conjunction, is like my whole thing is like, let's make sure it's not impacting people badly. So if we're going to make sure absolutely that it is part of whatever goes forward, that we are looking at how these things interact and what the cliffs are, then that's not necessarily as important to me. And I think that all of the things that have been raised are, genuinely good reasons to think about it in this frame. So just wanted to sort of be like, I take back my passion.
Okay, it sounds like we have consensus though then on two really solid recommendations. Karen and Deirdre, do you have any clarifying questions for us to help with your drafting? I mean, this is what's remarkable. Karen and Deirdre take everything that we've said, they take all of the testimony, and they produce that in a unified report and bring it back to us at our next meeting. And then we can make edits and amendments and suggestions to it. But I just want to acknowledge to the public and also to this committee how much work Karen and Deirdre do for us. So yeah, clarifying questions or additional?
Yeah. You want to go first?
Thank you, Senator. Yeah, and thank God. Well, I mean, I suppose we have audio recordings, but now I have a YouTube broadcast that I can rewind and replay and make sure that I got the details. But I guess what I'm hearing is, number one, some form of for a recommendation is a continuation of this study committee in some form, whether it's the same members or reconstituted in some way. So that I'm hoping gets to Ms. Daniels' concerns about an action. I mean, if the committee continues to supervise and oversee and make sure that there's movement forward, that's certainly one actionable item. The second recommendation that I'm hearing, which is kind of huge because it encompasses a lot of different elements. So that will be, there'll be an opportunity for you to review it, which is a good thing because there are many components to it, is the large scale economic feasibility study. And there are many things that I'm hearing the committee wants whoever conducts that study to look at resource dividends as a possible means of funding, basic income security. Also looking at racial and indigenous people disparities in wealth and race and touching upon those issues. And also sort of as a subset of that, I'm hearing from the committee to, I guess it could be a separate recommendation is to increase the efficiency of the current safety net, the system of safety net programs. But I think also within this economic feasibility study, I mean, that the study look at that current system and see how it may be more streamlined. And as someone pointed out, that would make more money available possibly for some sort of basic income, component. So those were kind of the primary recommendations that I heard. Continue the study, large scale economic feasibility study, recommend looking at and improving the coordination of current safety net programs. I feel like I'm missing something else, but Deirdre.
Yeah, I think generally I'm sort of where you're at. I guess my question more is the continuation of a study, well, it would be a new study group, but sort of the same idea with the same sort of potential appointees, the way it's described in the resolve, that the feasibility study would be part of that group would find some, like, is that's part of that group's function, or who's ordering the feasibility study? And that's where I'm unclear and I want a clarity.
So I think the feasibility study needs to be its own recommendation to move forward. Maybe the feasibility study is under the jurisdiction of the next committee, but I don't think the next committee should have to do what we had to do with a joint order to create a bill to try to find funding for an economic feasibility study. Does that make sense? Like, I'd like to see.
Yeah, but so I guess I'm trying to, we think a feasibility study should be done, and it's not part of the new study group, but then who do you want to sort of, like, somebody's going to have to look at proposals and ask for requests for proposals for a feasibility study. And then
fair enough. It could be that group, but if we could make the feasibility study something that also happens simultaneously with the creation of that group, does that make sense? So that group is coordinating and overseeing and commissioning the study, but that this permission, and this is where there was a learning curve for me in the process. I don't want that committee to have to go to the legislature to get authorization to do a feasibility study like
well, then you would write the resolve or whatever gets passed. So if this group is reconstituted, it has to be a new resolve that has to get passed, and that new resolve would have the duties and all the stuff laid out. So it would have to be written, whatever committee's doing that, and make sure it's very clear that part of this is a feasibility study, and that this group, if it's privately funded, if you're accepting funds, that's very clear in that resolve of how it will go about, so you wouldn't run into the issues you ran into last time around. You would draft that appropriately the first time around. So if that's the game plan, could be made very clear that the resolve is written in a way that allows that.
Yeah.
And Karen, go ahead.
Also, I just wanted to add, that reminds me of a point, I think it was Larry Danziger had made in some testimony, that also in just to be clear that the reconstituted study committee has the ability to continue to raise funds, because we really don't know how much this feasibility study is going to cost. And so I think having that flexibility in there as you move along, to have that ability rather than having to go back to the legislative council every time, we could at least make a note of it in the report that that's the intent moving forward.
I think that makes sense. Karen, when you were discussing the recommendations, there was just one clarifying thing, that something you said wasn't quite congruent with what I thought I heard, but if the committee disagrees with me, then we'll go with what you said. But you said an economic feasibility study that includes a study of how to streamline our existing social benefit programs. I saw those as two separate recommendations and almost two separate committees. But with the economic feasibility study, I think the very first thing that we wanted the study to include, before anything else, before looking at revenue, before looking at how to address racial equity, and reduce disparities was to look at what is the appropriate benefit amount based on existing cliffs, so that a basic income program wouldn't reduce economic security of the beneficiaries, but would in fact improve the economic security of the beneficiaries. So it was that piece, the cliffs, that I think was important to the economic feasibility study, because it was to determine what's the appropriate level of the benefit, just like Mississippi did, where they brought the economist in first to say, this is what the right benefit amount is.
Okay, so just by default, because they're looking at the cliff, they would be looking at the current system of safety net programs. But what you clarified is that there would be a separate recommendation that there be a study of safety net programs and whether or not there's collaboration and if it could be streamlined and therefore made better for the recipients, and also some efficiencies on time and money. Okay, so it's a separate recommendation.
Yeah. Sass and Smarley just raised their hands, so I'm going to encourage them to amplify or correct or add to what I just said or to what we're discussing. Go ahead.
I would just say that my only suggestion would be maybe even having there be at least an attempt to partner that with the Permanent Commission of Status of Racial, Indigenous, and Maine tribal populations. You know, now that we have this commission, I would encourage us to use their expertise and lived experience.
I see a lot of head nodding. Does anyone disagree with that as one of the duties or recommendations? Sounds like that's a yes. Sass.
That was initially what I raised my hand for. So I definitely agree with that. And also just a wee bit of clarity. So we're saying a separate recommendation that we are looking at how these programs like interact with each other, and if they can be streamlined. I guess I want to vocalize, I don't know quite how to have it. I am not suggesting we're cutting programs. That is only like, how can money be used? Like that money is still going to the same demographics of people, and possibly even more people, since our poverty, the line for poverty is so low. With that said, so just so that I'm like fully understanding it, when you're saying that's like a separate recommendation, that's still in tandem with the feasibility, right? It's not like a separate piece of legislation. It's
well, it could be depending on this report goes to the whole legislature. So in theory, it could be multiple committees, and maybe the looking at the safety net programs would be something that HHS committee would want to take on, whereas reconstitute, I mean, it might all be in the same bill, but it's sort of two different functions. And so the recommendations are all in the report together, but it depends on how this all pans out in the committee process and what it looks like. I mean, could be one bill from one committee that does everything you're recommending, but more than one committee could potentially get this report. And I think, right, Karen, because it goes to the whole legislature, this could be
to the whole legislature,
right?
Yeah. And the joint rule just reads that the committee of jurisdiction may report out a bill. So there actually could be more than one bill going through the system at the same time. And of course, as the legislators know, there would obviously be coordination of efforts, or maybe, this is kind of like, we're nonpartisan staff, but we have to be aware of the partisan nature of strategizing in the legislature, because it may be beneficial to have more than one piece of legislation moving forward that come from two different committees. But then ultimately, you don't want redundancy of efforts or bills conflicting with each other. In the end, there will be, something that comes out of the process. But and we have no control as staff people, certainly, or as a committee, of how things may play out during the session. But what's good is that more than one committee could submit a bill, you know, based on the recommendations of the report. And they may in the end kind of all streamline together. And, but we don't know what will happen in the future.
Okay. I guess then just to like, and sorry if I'm gumming this up because I'm not trying to, but I just want to make sure that we're not recommending that we study whether or not it's economically feasible without that being very directly attached to these programs, because if we are doing that, we're answering the question before we even know whether or not there are going to be negative human impacts. Do you know what I'm saying?
I have a clarifying question, Sass, because that I think was initially what Karen had said, and I had said, I had thought I had understood from you that your concern was about negative impacts because of cliffs and people losing their other benefits. There's a different piece that Representative Handy was talking about in terms of integration of programs and how they're administered in terms of accessing them and what the barriers are.
I feel like those go right together, right? Because if we were to introduce this as a program, eventually it would be, if we know how those things are interacting with each other, we'll know the answer as to whether or not this is going to interact in a way that cuts people off of health insurance or whatever.
It's interesting. I defer to the committee on this one. When I was listening to Anne, what I thought was interesting about one thing that she said, that she talked about how we could improve the integration of the existing programs, even if we never pursued a basic income program. And I think that there would be broad bipartisan support for that. At the same time, of course, there's a deep philosophical debate that we didn't really touch. We sort of assumed that there was consensus, but there are some people who think a basic income program should replace all of those other programs. And some, and this was in our testimony, I'm seeing some head shaking no's, like Anne and others who caution that basic income programs should be additive. And I think when we talked about the economic feasibility, we're making an assumption that it's additive, not a replacement program. So I guess when I think in terms of an economic feasibility study, if we're trying to get to a place of implementing a basic income program and trying to integrate all of these social service programs, I worry about, I think the cliff piece of it is hugely important because you have to calculate the appropriate benefit to then figure out how much revenue you need and then figure out whether the sources of revenue are adequate. And, you know, that's just the feasibility, the nuts and bolts of that piece of it. I think the larger question about whether the state should pursue some of what is happening in other states with integration of benefits through technology, like Code for America is pursuing, in some ways that feels a little bit outside the scope of an economic feasibility study, which is why I had said to Karen, I thought it should be just a crystal clear, that piece should be a separate recommendation. But oh, you're on mute. I'm not sure why, because I can't see the mute button, but. Huh, we can't hear you. That's really weird. No.
Sass, you may have to go out and come back in. The Zoom did this to me last time.
Okay. Representative Handy, that recommendation had been yours. Had you seen it as integrated in or separate from?
It's a separate recommendation.
I thought I heard,
Yeah.
I thought I heard someone earlier mention it, the idea of making a recommendation that's like a permanent group that looks at this. I know there was some talk, but I don't know if you ever settled on that. And so I guess I just wanted clarity that it be either, you know, a permanent commission or just another study group, like there's more study needed, but did you want to indicate that? Because someone earlier, I think, mentioned, I don't remember who it was, that maybe that should be a permanent group.
Yeah,
That
that
would be me.
was SAS, I think, that suggested the ongoing nature of it. But I'm envisioning an interdisciplinary group of leaders from the agencies that have the programs and others involved in that look. And then I think in that, as a result of creating that commission, if you will, that what should evolve from them is, and one of the charges would be to determine a matter of ongoing review.
Sass is back, and then Samarali also wanted to speak. Oh no. Samarali, do you want to speak while Sass is trying to figure out her audio?
Their audio, yes, I will. I was the one that had suggested it be a permanent, ongoing conversation. I personally would suggest that it be permanent and ongoing, as well as I love hearing Representative Handy speaking about like having representatives from those programs there. I would challenge to have an equal representation of impacted folk there, so that way that conversation can keep moving in a progressive manner.
Totally agree.
I'm fine.
But making sure that those two levels be, that they're equal, so that way there's some good representation. And that if that were to happen, maybe that there be an official training for folk that are not legislators, to know how to work within that group.
Well, the legislators could use it too.
I support everyone getting it.
Me too.
Sass, are we back with you?
I don't know. Can you hear me?
Oh, yes. There you are.
Let's see if I still have this thought. I think I do. I think my thought is this. I think it is, okay, if we're talking, which is how I thought we were talking about it as additive. So when we talk about economic feasibility, we're not just talking about whether or not it's feasible for the state to afford it, or for me, that's not all I'm talking about. I'm also talking about what are the impacts to the people receiving it. And if the impacts of the people receiving it, if we know that there's going to be a cliff, then we can be thinking about how it's feasible in ways that don't create that, which we can't do if we don't know if it's going to interact with a cliff. Like, because if it did, then maybe we would be considering doing something like having a portion of particular programs just be cash. Does that make sense? Am I saying it clearly enough? Like, yeah, it's just, for me, it's about like, this isn't just about whether or not Maine can afford it. Let's say Maine, what if we studied that? Maine could afford it. We gave everybody money, and then a bunch of people lost benefits that they actually needed.
I think we're saying the same thing. Or
Yeah,
I think that the cliffs absolutely has to be part of the economic feasibility study. I think that making sure that the benefit amount is calculated in a way to support and improve people's lives and not do harm is really important.
But if it ends up being a separate,
No, that should be part of the economic feasibility study for sure. But what should be separate is an ongoing commission to figure out how to integrate all of the other programs and to improve their outcomes and to reduce barriers. So like tackling the substance of how those other programs are working is a separate piece, even as calculating how they interact with each other in terms of cliffs and benefit amounts is part of the feasibility.
Okay, I was seeing these two things as mutually exclusive, so the problem was my perception when it was said. Sorry.
I think we're in both and I know some people have a hard stop at 2:30. Karen and Deirdre, are there other clarifying questions that you have?
I think we got the general.
Clear as mud, right?
Very general.
And we have, like she said, YouTube and the audio that we can listen to 10 times over to make sure we got it right. But I think, yeah, we could probably at least get something on paper and drafted. And there's always the next meeting to clarify if we misrepresented something or misunderstood anything, or didn't make a point strong as you wanted that point to be made or something like that. So there's at least another shot at looking at it.
It's definitely the purpose of the third meeting, which leads me to one question that I have for the chairs and the rest of the committee. So we have a few days before the next meeting. And so I guess Deirdre and I spoke a little bit and thought, well, maybe if we got something to you by end of business Tuesday, and then I realized, oh yeah, that's election day. So maybe you wouldn't even be looking at this report Tuesday evening. But I don't know what's fair. I'd like to give you, obviously, it's not going to be a super long report, but I do want to give you the opportunity to read it and think about it, and so that you're prepared for Thursday's meeting. But I'm just wondering what the committee is thinking.
I think if you get it to us by close of business on Tuesday, it would be fine, in part because when we get together on Thursday, by virtue of the way the committee process works, we'll be looking at it together closely at that time. So, hopefully everyone can read it ahead of time, but even if they can't, they can be reacting to it on Thursday, you know, in the group process of reading it together out loud. Sass, you had a clarifying question or feedback on that?
Yeah, just a question about when we very first started doing the work session, I was saying there was like a couple of questions that I had for the Magnolia Mothers folks. Is it possible, I don't know if this is like the type of task that Karen and Deirdre do, but is it possible to extend those questions to them and try to have that information in with what you send over to us, so that when that way, if we're like making a recommendation out and they already have some thoughts about things that should be like very specifically considered, we can have that as part of the recommendation that goes out.
Yeah, so maybe if you could send me an email, or if you noted your questions, of course, I can listen to the, I know I took notes, but
I can send you an email, but just for the sake of transparency, I can say that the question really was like, if we had all the time in the world, what specifically would you have us research? What were the questions you were asking the economist, and what questions would you have asked the economist knowing what you know now?
Okay. Yeah, if you don't mind forwarding that to me in an email, and then I could forward it to Aisha, sorry. I misspelled her last name on the agenda. I'm sorry about that. It was misspelled in an email. Anyway, yeah, I can certainly do that. Of course, we have 3 business days, so just, you know, I'll do my best, but we don't have a lot of time. But I will do that. And I believe there were some questions that Ann Danforth from Maine Equal Justice was going to get back to the committee on. And again, we'll do our best to get the answers to you for the next meeting.
And Karen and Deirdre, if you run into roadblocks with a report and we're seeing it for the first time on Thursday, that would be not ideal, but we could deal with that.
Okay, well, we'll do our best to get it to you, at least some semblance of in advance. Because I know I don't like getting committee amendments when I'm sitting at the work session table.
Fair enough. Fair enough. I know we're asking you to do a lot in a short period of time, and we are grateful for that. So thank you.
Okay.
Thank you very much. Any other questions, comments from the committee before Karen and Deirdre depart to put this all together into one?
Yeah, I'd like to echo publicly, you know, my appreciation for Karen and Deirdre doing this work. I do not envy you, and I appreciate you.
Thank you.
Hear, hear. Great. Well, seeing no other comments or questions, I want to thank everyone for sticking. This was a 4-hour meeting without a break, without lunch. It was very efficient. Thanks everyone for your time, and we look forward to meeting next Thursday at 10 a.m. via Zoom again to finalize our report and recommendations. So have a great weekend, everyone. Bye.
Thank you.
Bye.
The meeting is adjourned.